Okay, good morning, everybody, and welcome to this meeting of the Children and Young People Overview and Scrutiny Committee. It's fantastic to be back in County Hall. It's very different to Zoom. We've all had to put suits on for the first time, I think, in a long time, but welcome back. It's great to see you all. And I'd also like to welcome our new members as well to the committee. So we've got Councillor Steele and Councillor Holmes, and a special welcome to Councillor Holmes as well as a new member to the council. So we're really throwing you in at the deep end. It's good to have OMC with us as well. Members will remember that in January it was agreed that members of OMC would join us for this meeting, and it's good to have them here. So just a few sort of housekeeping issues before we start. We've gone through the rules for using the microphone system in the chamber. For the benefit of those joining us by Zoom, the virtual hand system is still in place. So if you would like to ask a question or come in at any point, raise your virtual hand and we'll keep an eye out for that. If you wouldn't mind keeping yourself on mute in the meantime, it'll just stop any unwanted distractions. So unless there's anything else members have got to say before we get started, if we can start with then declarations of pecuniary and non-pecuniary interests. I recognise that this will be common for members of children and young people, but if members of OMC could also just consider whether they have any interests as well, that would be really useful. So Councillor Coultish.
Thank you, Chairman. I'm a governor of Gaul Academy. Thank you.
Councillor Johnson.
Good morning. Thank you, Chair. I'm a governor at East Riding College.
Thank you, Chair. I'm a governor at Boodbury Primary School.
Thank you, Chair. I'm chair of two nursery schools in the East Riding.
Thank you, Chair. Chair of the sorry, I'm not Chair. I'm a regular governor at the Hub School.
Governor at Westfield School and Dunswell. Thank you.
Governor at Cherry Burton Church of England Primary School.
Thank you very much for those. Okay, if we can then move on to agenda item 2, which is to approve as a correct record the minutes of the Children and Young People Overview and Scrutiny Committee meeting held on the 21st of April. That's pages 1 to 7 in your agendas. Is everybody happy with that? Moved by Councillor Chadwick, seconded by Councillor Meredith. Thank you. Right, okay, on to agenda item 3 then, and that is an update on the COVID recovery plan from the Director of Children's Services, Owen Rush. Good morning, Owen.
Good morning. Thank you, Chair. Just a short update from me this morning. Whilst recognising that we're moving increasingly into a recovery phase, it's really important, I think, to remember that the pandemic is still very much with us at the moment. And in those circumstances, the priorities across the services have remained absolutely the same. A focus on the support for our most vulnerable children, support for our schools who continue to do a fantastic job in some really difficult circumstances, and a focus on our workforce to make sure that we continue to have the capacity and the resilience to deliver those services. A positive picture to report in terms of self-isolation for children. We're heading down now to about 1.2% of the total school population who yesterday were missing school because they had been in contact with somebody with a positive test. All of those children have the opportunity for online or virtual learning when they're not in school, but we do see those numbers continuing to decrease. Watching the figures closely because, as the committee will know, there remains some nervousness about the latest variant of the virus. There are some unknowns in terms of the impact in terms of the schools and school attendance, but the picture at the moment remains really positive. I'm pleased to report, as we talk about returning to a new sort of normal, that the work across our schools to support the emotional and mental health of children that will have inevitably been impacted during the pandemic continues to grow. Our programme Wellbeing for Education Return, the government programme, is rolled out across the schools at the moment, and I'm delighted to say that there is a proposed second phase of that. And in a nutshell, that is a programme which provides advice, support, and in some cases practical interventions across and with schools for children who may have been impacted disproportionately as a consequence of the disruption over the last year or two. Staying in touch with our most vulnerable children still remains our absolute priority. So where children can't be in school, we are in regular contact with them, and that process has continued right throughout the pandemic. Pleased to report that those arrangements were reviewed last week as part of an Ofsted-focused visit and found to be robust and effective. And we intend to continue to work on those arrangements right until the pandemic has fully passed, and to learn some lessons as a legacy of the pandemic about how we might work in those ways going forward to the future. Our free school meal arrangements over half term have been confirmed, and they'll be funded by our local support grant, which means that we'll be able to continue to support families during that period. So overall, an increasingly positive picture. There is no complacency, I don't think, on anybody's part about this critical phase that we're now in. But again, would want to reiterate, huge thanks to the workforce and to our school colleagues who are now navigating carefully children's return back to as normal a learning experience as possible.
Thank you. Thank you, Owen. Has anybody got any questions? I've got a hand up from John. Just on mute, John.
Thank you. Just thanks, Owen. Just two quick questions, if I may. Could you give us an update on where we are with this sort of numbers of parents that have continued to exercise homeschooling? We saw a rise, understandably, possibly over the course of the pandemic. I'm just wondering whether parents are now returning children to school, or whether we've still got a reasonably sizable group that are exercising that option. And second question, if I may, what provision are we putting in place for summer schools, summer clubs?
Thank you, John. The elective home education arrangements in East Riding are monitored really closely by our Education Welfare Service. And you are right, we saw an increase, as did many local authorities, in the number of parents electing to home educate at the height of the pandemic. We have been, I'm pleased to report, in touch with every single one of those, and there's a couple of themes that emerge through those conversations. One is the very understandable anxiety by parents, particularly where children may be more vulnerable, or parents perceive them to be more vulnerable, of allowing them into the school environment during the height of the pandemic. You're absolutely right, that has now started to recede, and we're seeing the numbers of those children who are now electively home educated starting to return to previous figures. I think it's fair to say also, though, that the experience of some parents home educating has been a positive one, and for those, they will opt and elect to continue to do that. It's a timely question because you may know there is a national review of the arrangements for elective home education, just to make sure that those children where parents opt for that form of education are receiving an education that is equivalent to and sufficient to an education they might receive if they were participating in the national curriculum. So it's something we're watching closely. It's something that we expect some further guidance to come out over the course of the next year. But as one of those authorities that's retained an Education Welfare Service, I'm pleased to report that we have the ability and the capacity to stay in regular touch. And it's worth saying, the tone of that contact with parents is very positive. Our education welfare officers run a coffee afternoon for parents who've elected to home educate, to have conversations about the nature of the education, how that can be supported, and critically, where parents subsequently want to enter children into exams. All of those issues are kind of on the table and open for discussion with parents.
Thank you.
Thank you, John. I've got Councillor Coultish next, please.
Thank you, Chairman. Hi, Owen. Good morning. Do we have a picture for the local authority on how many schools are continuing compulsory mask wearing for teachers and students, despite the guidance not stating it's necessary? Thank you, Chairman.
Thank you, Councillor Coultish. It is a mixed picture across the school estate at the moment, and there's several reasons for that. The decision ultimately about the use of mask wearing rests with the school, but those decisions are informed by a variety of factors. Certainly, there are school settings where the size of the school and the ability to exercise social distancing because of the layout of the size of the school is greater than in other schools. And in those settings, the extent to which mask wearing is advised is less. Mask wearing still remains compulsory on our transport, and generally speaking, mask wearing in public spaces in school settings is advised. But I'm conscious that individually head teachers are taking advice directly from our public health colleagues to try and make the best decisions for their individual settings. And of course, ultimately, there's a wish and a hope to remove as far as possible the need for that protective step in schools as soon as possible.
Thank you, Councillor Coultish. I've got Councillor Bayram next, please.
Thank you, Chair. I'm hoping I heard what Owen said correctly. Did he say that free school meals are going to be funded over the half term? And if he did, how long are we going to carry on funding free school meals for in the holidays?
Thank you, Councillor Bayram. Yes, that's absolutely right. The free school meal arrangements are funded over the half-term holiday. And we, like many local authorities, are in conversation with the Department for Education to look at the sustainable future of those arrangements. Certainly, as I say, there's no doubt that we will be able to fund those over the May half-term. Our wish is to be able to continue to do that on a more sustainable basis. But as I say, we're waiting at the moment for some further guidance and information from the DFE about how that might be funded and how those arrangements can be confirmed.
Thank you. Is that okay, Councillor Bayram? Great. Owen, some schools I've noticed I get sent a list of the schools that are currently experiencing pupils that are having to self-isolate, and what I'm starting to see is a pattern emerging, and it's some of the same schools that are coming forward more regularly than others. In fact, there are some schools that seem to be perpetually on the list. Is that just bad luck, or is it significant factors which need to be addressed, and are those being addressed with the help of public health and others?
Thank you, Chair. Yes, public health and colleagues across the Directorate are monitoring on a daily basis the figures and then watching for any significant trends. At this stage, I think it's very difficult to say if there are, if you like, systemic issues leading to specific settings having higher or less infection rates or self-isolation as a result of positives. But I would want to reassure on 2 points. One, that analysis is being done because it's incredibly important that if we can learn lessons from one setting that are transferable to another, we do that. But also for every single case where there's a concern, the outbreak management arrangements are scrutinising really carefully what may have led to that. And there are lessons being learned on a daily basis. Some of that's at a granular basis where individual, perhaps staff members or others may have missed a particular step in our self-isolating arrangements, or perhaps, very rarely an example of poor judgment. But we haven't yet identified any systemic issues for those schools who, as you described, have had the bad luck of greater numbers of children having to self-isolate. Overall, when we look at our figures and the extent to which schools have been able to retain children in school across the East Riding, it compares very, very favourably with other local authorities and in fact nationally. So we're reassured that our schools are actually taking every precaution they can to sustain as many children in school as possible. But I would reiterate, there is no complacency with that. And I think both the school community and ourselves in public health are all open to and wanting to learn any lessons on every occasion that we find an outbreak or a significant number of children who have to miss school for a short period.
Thank you. I've got Councillor Meredith next, please.
Thank you, Chair. Hello, everybody here and at home. All my questions are actually transport related. Just very quickly, how has transport been affected by the pandemic? Have we seen a dramatic increase in the costs? And have we seen any changes in practice which have actually been of benefit and could potentially be rolled out as the norm moving forward?
Owen, we've lost you. We can't hear you.
Apologies, Chair. I lost the first part of that question. I'm really sorry. I'd be grateful if Councillor Meredith would repeat it.
Yeah, of course, Councillor Meredith.
No problem at all. How has transport been affected by the pandemic? Have we seen any dramatic increases in the costs of delivery? And have we seen any changes in practice which have been of benefit and will be rolled out as the norm moving forwards?
Thank you. Inevitably, there have been some swings and roundabouts in terms of the transport and costs. For periods over the pandemic, we've had to transport fewer children because of some of the periods of lockdown. But of course, for those children that we did transport, the social distancing requirements inevitably meant that more transport was required because of the space needed on certain vehicles. We've enjoyed really good relationships with our transport providers. They've worked really closely with us, both around the social distancing and the safe practices, and again in looking at how we deploy certain routes, given the smaller and different cohorts of children who need transporting. But like every other aspect of the work that we do, as we move out of this pandemic, we are looking really carefully at the future, transport arrangements included, to see if there are any lessons to be learned from the last 14 or 15 months, and to think again about whether there are some efficiencies or changes that we can keep and sustain going forward. So I think certainly over the next 2 or 3 months, we'd expect to start to bring forward some learning, some recommendations about what that will look like.
Thank you.
Thank you, Councillor Meredith. Just before we move to the next question on my list, I've got another one for you, Owen. And this is on whether there's been an update on the process for GCSE and A-level results for our young people, and whether there's going to be any support offered from the council to schools or to individual parents to support them through that process.
Thank you, Chair. We are still waiting for some further advice and guidance, and with your agreement, I would quite like to arrange for a written briefing for the committee once we've had that detail, because absolutely right, we want to make sure, having had the experience of last year, that we're able to kind of support and offer advice out to our schools and to parents about how the system will work and what that might mean for children's progression through the system in coming years. So we're hoping anytime shortly we'll get some of that advice and a detailed briefing note would follow.
Thank you. Can I suggest then that we arrange for that to form the substance of the next meeting's COVID update as well?
Certainly.
If we add that on as a recommendation, Alison, thank you. Fantastic. Okay, I've got Councillor Handley next, please.
Thank you, Chair. Owen, in the Easter holidays, this council not just gave the free school children a £15 voucher, they also provided an extra bag of food as well as skipping ropes, balls, etc. It was very, very well received, and I, in my other life, do run one of the food banks where I help distribute the food to the people. Are we looking at doing that over the 6 weeks holidays? Is there any scope for that? Thank you, Ronnie. I can see you shaking your head, nodding your head there. Okay, thank you. Thank you.
Chair, with your agreement, I would suggest Ronnie has been responsible for leading the Holiday and Activity Fund, which is part of the project that Councillor Handley's described. So with your agreement, I'm sure Ronnie would be happy to just give a very quick update on what the summer programme will look like.
Yeah, thank you. Ronnie, if you're happy to, we'd love to hear from you.
Yeah, so we did participate in the healthy food and holiday activity scheme over Easter. It was predominantly virtual. We worked in partnership with VAS and the Food Poverty Alliance, and we did manage to target a significant number of families across the East Riding of Yorkshire. And it was a mix of online activities that were all very well received and taken up, healthy food with meal planners, and a range of activities that could be done at home with the equipment provided to the families to enable them to do that. Really good partnership work with our voluntary sector, and the plan is to roll that out for the summer holidays, over 4 weeks of the summer holidays. Similarly, it's got to really promote healthy eating and physical activity, and so the plan is that we will do that over the summer break and also the Christmas period. So it's a rollout of a programme from the Department for Education, and we, have put together a really exciting partnership. So it'll be more obviously face-to-face activities, hopefully, across the summer period, whereas we predominantly delivered virtually during Easter. So yeah, that's the plan.
That's great. Thank you. Thanks, Ronnie. I've got Councillor Steele next, please.
Thank you, Chairman. This might have been partly answered, but in the interest of keeping the spread of COVID down around schools, especially primary schools, I have noticed certainly in my area that more parents are taking the children to school, not using the school buses. Are the parents given some instruction on what they should and shouldn't do in terms of delivering and picking up the children to reduce that risk?
Thank you, Councillor Steele. Those arrangements are negotiated directly between individual schools and parents, but there's been some advice offered from the local authority, and we know from individual conversations with schools that they've taken real precautions in making sure that parents, whether they're dropping and collecting their children by car, whether it's queuing up to collect them after school, are exercising safe practice around social distancing and avoiding that clumping and clustering that you would, hope to see in normal times. So we feel really confident that schools are issuing really helpful and supportive advice to parents. And I think some of the figures that we're seeing in terms of the numbers of children having to self-isolate as a result of positive tests, and that declining figure reassures that those steps are effective and working.
Thank you.
Thank you, Councillor Steele. Owen, I think it's fair to say that the last year has been incredibly difficult for a lot of our school staff. How is their morale at the moment, and what are we doing as an authority to help support them through not only what has been a very difficult time, but what promises to be an even tougher time going forward, as we have to start catching up?
Thank you, Chair. And this is impressions at this stage from our direct contact with school leaders and across the workforce, is that the schools have shown incredible resilience over the period of the last 14 and 15 months. One of the things I think that has both kind of driven the schools on and sustained them has been their singular focus on the children, young people who attend their settings. All of the conversations we've had have been about how we can continue to work to support children and young people. Inevitably, there has been a cost for the professionals involved, both in schools and across the council's workforce, and it would be absolutely wrong not to pretend that people weren't tired. And of course, we're not through the pandemic yet. So it is that sense of, there is, as you say, a tough time ahead. My impression from speaking with school leaders is that they and the workforce are totally focused on trying to navigate and negotiate a safe return for children. We're all watching carefully to understand what the impact on children's learning has been over the last 14 months. And of course, for children who may be more vulnerable, what the impact on their emotional and mental health has been. That places an additional stress or burden on school leaders and on staff in schools, because in addition to what might be described as the day job, there's a more holistic task or responsibility for the children coming into school. So I think people are tired, but I've seen absolutely no lack or waning in the commitment to getting this right. I think the strength has been in the whole system approach, where schools, local authority staff, health staff, and professionals from right across the piece, including the voluntary sector, have continued to work as one in the face of this terrible pandemic to make sure that we get through it and have the right outcomes for children. I suspect there are lots of schools looking forward to a break at the summer, but we've no sense at the moment that that commitment or that kind of energy is waning. And certainly, feedback, as I say, across the workforce is that children are making that adjustment back to a more normal learning environment really well.
Thank you, Owen. Right, we've got no more questions from members. So thank you very much for your update. And if we can move on now to agenda item 4, which is the Special Educational Needs Development and Improvement Plan Progress Update. And am I turning to you first, Owen, or straight over to Ronnie?
Sure, I think it's straight over to Ronnie.
Very good. Right, well, thank you, Ronnie. Good morning.
Good morning, Councillor Weeks. I'm going to attempt to share my screen and hope the technology doesn't let us down. So let's see how we get on. Okay, can somebody indicate that they can see that?
Yeah, we can see that.
Okay.
Thank you.
If at any point I cut out, I think somebody's going to need to wave at me, because I can now only see a very small select number of people in the chamber. Members have had a copy of the report, but I'm actually going to present this through the delivery of a presentation. I'm actually going to stop partway through the presentation and try and navigate to another screen. So if you can just bear with me whilst we do that. So this, as Councillor Weeks has described, is an update on our special educational needs and disability SEND development and improvement journey in East Riding. Before I kind of move on to the main body of the presentation, I just wanted to say that the plan is a living document, which will be added to and refined through continuous insight. It consolidates all the existing improvement activity, which was clearly in evidence when I joined you in East Riding 6 months ago. And it presents a direction of travel, a roadmap for the SEND system moving forward. It's one plan, one purpose, the best outcomes for children and young people with special educational needs and disabilities. Children and Family Services is a pivotal partner in the development and delivery of the plan, but the plan does need to be co-owned by all partners to have the impact that we all want, which is the best outcomes for children and young people with SEND. There are in the region of approximately 6,500 children and young people with additional needs across East Riding, both at SEND support, SEND support, so children pre an education, health and care plan, and also that cohort of children who have an education, health and care plan. And it's £6,500 children plus, because that will change on a day-to-day basis as more children come into the system and needs are identified. The plan encompasses all children with additional needs, so both cohorts, and I think that has been a question that's been asked. Is this just a plan for children with an education, health and care plan? Its ambition is to provide a direction of travel for all children with additional needs within the system, our current children, but also our future children, in relation to its ambition and impact. just wanted to say that changing a system takes time. Understanding what the current system is in East Riding has been my starting point, and I've undertaken a diagnostic to establish what we do and what we do well, and areas where we need to improve. I've used a variety of data sets, which I'm going to take you through in a minute, to triangulate need, provision, outcome and impact for children and young people. Seeing and feeling the impact for service users also takes time to evidence in relation to satisfaction and confidence across this system. We are not getting it right for all families, and the plan presents how this will be addressed moving forward. It is also important to recognise that the improvement within the SEND system is being undertaken within a COVID context. I think within 6 weeks of me joining you in East Riding last November, we were back into a national lockdown. Despite the significant challenges this has presented, improvements have continued and the teams have worked really hard to continue to drive the changes forward at pace. So I just kind of wanted to preface what I'm going to present within that context, if that's okay, Chair. So hopefully this will move on. So in terms of the context that I've looked at in relation to SEND and in helping to formulate the development and improvement plan, we weren't starting with a blank page within East Riding, as I've already indicated. But I've taken the opportunity to go back to the 2014 SEND reforms to check if we were delivering all the statutory things that we must do as an authority, as outlined in the 2014 SEND reforms. I think the 2014 reforms set out a really comprehensive ambition and programme of reforms. But at a national level, I think the how that has worked through nationally, I think there have been things that have worked really, really well and things that have worked less well. And we're all trying to kind of grapple with that at a national, regional and local level. East Riding undertook or was participated within a peer challenge review in 2019, and there were a number of areas identified, areas of focus really, which included our statutory compliance, so how timely our assessments were being done for children and young people with SEND. It talked about co-production and voice with both parents and carers and children and young people and all stakeholders across the SEND system. It talked about how well we were preparing our young people from their earliest years for adulthood, and how we were also supporting our SEN support cohort within schools and settings. Members may be aware that there's a review that is due to present 5 years on from the reforms, which is identifying some of those national challenges, how we ensure that we have a sustainable system, and it's looking at the cost implications and how well we've been able to meet need across the SEND system following that comprehensive implementation of the reforms in 2014. East Riding is one of 6 local authorities in Yorkshire and Humber still to receive its inspection under the existing regulatory framework. And I've just added a couple of slides into the presentation about this. I think by my calculation, the first point at which we...
Ronnie, I'm sorry to interrupt, but I think we're going to adjourn for a few minutes, if that's okay, while we can get some paper copies of the presentations printed, because we're really struggling to see it at our end. Is that okay?
That's fine.
It's just with the size of the screen and the distance that we're all sitting at, I think we're all struggling to read the information. So with the committee's permission, I think we're just going to adjourn for 5 minutes while we get some paper copies circulated to members of the committee. Okay, is that okay? Thank you. The paper copies are starting to arrive, so it shouldn't be too much longer. For those that are on Zoom, we're going to get started again in a minute or so. So if you want to come back.
We're just waiting for a few more copies to come through, but we'll bring them through and distribute them as they come through. Seems to be having a bit of a printer issue.
Okay, right, members are all back in the chamber now, so thank you so much for your patience. As Alison said, we're still waiting for a few more copies, but they'll be brought in as and when they're done. Ronnie, I'm so sorry to interrupt you as you were in your flow, but members who desperately need them have got copies now, and the rest will be brought in as and when. So if I can hand back over to you, and we'll carry on, please.
Right. Thanks, Chair. I also do appreciate this presentation is very long, so I will try and kind of speed through this, but making sure that you've got all the kind of relevant information that you need. So in relation to area send inspection, and can I also just check, Chair, that everyone can hear me in chambers as well? I don't have the loudest voice, but I'll try and speak up.
Yeah, no, that's fine. It was a bit quiet before, but I think if you can just sort of shout into the microphone, then we'll be able to hear you.
Okay,
right.
Thank you.
Thank you.
So in terms of area send inspection, as I said, East Riding is one of 6 authorities in Yorkshire and Humber still to be inspected under the existing regulatory framework. It's just a bit of a kind of reminder, really. It's an area send inspection. It's not a local authority inspection. It's a joint Ofsted and Care Quality Commission inspection. And there will be a team from Her Majesty's Inspectorate from Ofsted, a Children's Services Inspector from the Care Quality Commission, and a local authority Ofsted Send Inspector. The inspection framework takes place under Section 20 of the Children and Families Act. So it is really kind of important that the SEND development and improvement journey is a whole SEND system. It is not just about the local authority response. Members may be aware that inspections were paused in March 2020 due to COVID, and re-inspection for areas with a written statement of action have recommenced from April 21. Full inspections restart from June the 21st, and that date is being kept under review. So that gives us around 4 weeks before, excluding the May, early June bank holiday, to the earliest point that we may have our inspection triggered in the East Riding. The inspection will look at how well the area identifies children with SEND, both East Riding children and young people in county, but also the children that we have out of local authority. How well do we meet need, and what are the outcomes for those children across our area? It will want to understand how well does the area know itself? Do we have a good understanding of how effective we are and our areas of strength and development? A range of evidence will be looked at in relation to our performance in relation to children and young people with SEND. They will look at academic attainment over time, looking at both attainment and progress. Now that presents some particular challenges with the last academic year in terms of the suspension of national testing. However, they will want to look at progress and how we've monitored that. They will want to look at rates of attendance for children with additional needs and exclusion. So how many children have received fixed term exclusions or have been permanently excluded. They will want to look at destinations, including our children not in education, employment and training. Diagnosis timescales may be one of the things that they want to look at. Outcomes of any local authority inspections and outcomes of any educational establishments that have been inspected. They will want to look at complaints, so what complaints we've had across the area and what we've done about those. and they'll want to look at our local area performance in completion of assessments and issuing of education, health and care plans within statutory timescales. They may want to look at rates of appeal to first tier tribunal and any other significant and relevant concerns brought to Ofsted or the Care Quality Commission's attention. The outcome of that inspection is not a judgment as members may be familiar with in relation to the school system. So it's not an Ofsted judgment, but we could receive a written statement of action if they identify any areas where we are not performing as we should be. So I just wanted to mention that because I think we are fast approaching that point. And if that inspection doesn't trigger within the summer term 2021, I anticipate it will trigger early into the autumn term. So I referred earlier to undertaking an initial diagnostic of what was happening within East Riding. So that's partly what I've been involved and engaged with since joining you mid-November. It's had to take a slightly different form than perhaps I would have done if we were not all dealing with the COVID pandemic. So I haven't had the opportunity to meet people face to face, and I am planning a series of visits into our schools and settings across East Riding, starting with our specialist provision and then extending that to our additionally resourced and mainstream provision. So part of what I've been doing is trying to understand the area. I'm not from East Riding. I didn't know East Riding particularly very well when I joined you mid-November, but I've been very much getting up to speed with the geography of East Riding and the population of East Riding and how it's distributed across the county. I've been looking at what needs we have in terms of our children and young people with additional needs, and understanding those needs and whether there are any patterns about how those needs occur across the East Riding, and understanding demand for places and cost of places. So how are we spending our resources? Are they being spent efficiently and effectively? And are they able to evidence improved outcomes through evidence-based practice? So are we always getting the best outcomes for our children and young people in East Riding based on an efficient use of local authority resources? I've talked a little bit in my preamble about a whole system inclusive ambition for children and young people with additional needs. I think there's lots of ambition, but I think we need to ensure that we are all on the same page with that inclusive ambition, so we can demonstrate across education, health and care that we are having that kind of improved impact. There are some principles underpinning the approach that I've taken since I joined you, but also the whole system approach. So I think it's really critical and important that the system is equitable, fair and transparent. I'll take you through some of the things that we've put in place in order to ensure that happens. I've worked for many years in early years, and I think one thing that stuck with me from an early years perspective is parents and carers only having to tell their story once. It's extremely frustrating and time consuming for families where they're having to tell their story multiple times to multiple professionals who may be involved in the delivery of the care or education or support for their young person. So how do we ensure that we are listening to what parents are saying, and we're developing a system that enables that parent story not to have to be repeated multiple times? It's got to be a system that's based on early identification and intervention. So is our system doing that across the East Riding? Are we identifying the right children at the right point and putting in place timely interventions? We need to have a system that fosters creative solutions. We need to be very risk aware, but not risk averse. So I think there are opportunities across the East Riding to intervene differently. And so really keen to look at how we foster those creative solutions across the whole SEND system, particularly in our partnership arrangements with our colleagues within health. We want a system that inspires, motivates and empowers. It's, you know, it's an area that people work in, and we want everybody to kind of come to work every day and do the absolute best that they can do, and be supported to do that, and to be really clear about what the performance management framework is around that. But actually we want something that inspires people and motivates and empowers. And we are wanting to co-produce everything that is in the development and improvement journey. The plan that I'm going to present to you consolidates all the existing activity that has been developed over a number of years, alongside a number of statutory things that we must do as an area. And I think there's very much clear evidence of co-production throughout that. So in terms of our East Riding vision, so our inclusive ambition for all children and young people with additional needs, we want them to be valued and their outcomes are important, and all parts of the system recognise this and work together to support children and young people to achieve their ambitions and to lead independent and fulfilling lives. We want all children and young people to have the best start in life. So in terms of the support that we're able to provide in relation to that children and young people are proud to come from East Riding, and that children and young people with additional needs live and are educated within the East Riding. That is absolutely critical to the approach moving forward. And that children and young people with additional needs make good educational progress and have high aspirations and good life opportunities. So as part of that kind of triangulation of need, provision, outcome and impact, I've undertaken activity to look at how we compare in East Riding compared to the England average and also to the Yorkshire and Humber average. So this is describing the East Riding of Yorkshire in terms of the percentage of pupils that we have with SEND, and then the mean for all English unitary authorities. The graph on the lower left-hand side talks about the percentage of pupils with a statement or education, health and care plan. It conveniently, this is the national data set, flips around the colour coding, which is really helpful. So East Riding on the bottom left-hand side is the line in yellow, and the mean for all English authorities is the pink line. So percentage of pupils with a statement or EHC plan, we are broadly in line with the England average. Percentage of pupils with SEN support in all schools is the lower right-hand side graph, and we are tracking below the average for SEN support. In terms of a comparator with East Riding compared to the Yorkshire and Humber average, it's broadly the same. So we're broadly in line in relation to EHCPs, but slightly below in relation to our SEN support numbers and figures compared to Yorkshire and Humber and the national average. Performance, so compliance within 20 weeks. So this specifically relates to the education, health and care plan process. You can see we've had a very interesting journey in East Riding. And East Riding is the graph in red, and the graph in green is England, and the kind of purpley blue line is Yorkshire and Humber. So this is the from the something called the SEN2 data return, which was published last Thursday. So the national average for 20-week compliance has dropped slightly to 58.7%. The Yorkshire and Humber average has increased to 71.1%, and East Riding is tracking at over 95% compliance for education, health and care assessments undertaken and plans issued where a plan is required within the 20-week statutory timescale. Disagreement resolution. So number of appeals as a proportion of appealable decisions that go to something called the first tier tribunal. East Riding of Yorkshire is the graph in green, Yorkshire and Humber is in red, and the England average is in the kind of limey green colour. So in terms of East Riding, we're tracking slightly above Yorkshire and Humber by 0.1%. But below the England average. That does not mean that that's acceptable. So anything that goes to tribunal, as far as I'm concerned, is we haven't been able to mediate an outcome for those families, and they've taken a decision to go to tribunal. But I think it helps to compare where we are compared to Yorkshire and Humber and the national average. In terms of accessing provision, so I've looked at the percentage of children and young people we've got in our mainstream schools and then in our specialist provision across East Riding and compared to Yorkshire and Humber and the England average. Now, this is really interesting in terms of, if you look on the far left, you can see the figure in blue is the mainstream school cohort, and red is children and young people accessing specialist provision. And the England average for specialist provision is around the 39% mark, with 37% accessing their provision in specialist provision. Compared to East Riding, where we have 22.95% of our cohort in our specialist provision, and just over the just below, sorry, the 50% mark within mainstream. So in terms of what that kind of indicates is we've got highly inclusive provision across the East Riding of Yorkshire, or we've got a real issue with our sufficiency of provision across the East Riding, which I'll come on to in a minute. I've done some cost analysis, so looking at how we fund SEND and how East Riding compares to Yorkshire and Humber and the England average. So this is per place funding, per head for special schools and alternative provision pupil referral units. And this is a reportable data set that goes back to central government. So we can do that comparator. So in East Riding, we in 1920 spent on average £80.12 per place funding, compared to £117 for Yorkshire and Humber and £133 as the England average. In terms of top-up funding, so this is funding that's drawn down when the child is in receipt of an education, health and care plan. We track slightly better in relation to Yorkshire and Humber in terms of the amounts that we're spending, but both Yorkshire and Humber and East Riding as part of the Humber track below the England amount. Again, in terms of what that means is that, are we directing our resources to the right parts of the SEND system in order to enable children to access their learning in the right parts of the SEND system, so that we're not escalating children up the graduated offer into more specialist provision unnecessarily. And that's about how are we spending what we have available, and is it proportionate? Outcomes data. So I talked about, we've got obviously some real challenges with 2020 attainment levels, but in terms of the last set of data that we did have available for level 2 qualifications, so that is GCSEs, and I still have to do the children achieving 5 A to Cs, even though we're on to the new system, so to do the conversion back. But actually we are, for children with a statement or education, health and care plan, we're tracking slightly above in terms of GCSE outcomes. and significantly above for children with level 3 qualifications. So that's your A level or equivalent. What that initial diagnostic has identified for me are a couple of areas of particular focus. So I think children that are not in education, employment or training is an area of particular focus because we are tracking above the England and the Yorkshire and Humber average. At England, just over 2% and 2.72% for Yorkshire and Humber. We've got in the region of 4.55% of our EHCP cohort who are not in education, employment and training. So that is a particular area of focus, and there's a strand of activity that sits in the improvement plan that addresses that position and brings us back in line with where we need to be. I don't know what they're doing in North Yorkshire, but they have very few children that are not in education, employment and training. So I think it's also about looking at areas where they have got really positive outcomes in this area and how we can learn from each other. Another area of focus, I think Erin referred to children who are electively home educating. And it is an area of focus because in East Riding, we have 1.4% of our cohort who are electively home educating, which tracks us above the Yorkshire and Humber and the England average. That equates to 41 children and young people who are electively home educating who have an EHCP. And it's about making sure that we've got that in view to make sure that that is a choice that families are making as opposed to a choice that they're making because there's an issue with sufficiency, which I'll come on to in a minute. So in summary, we've got 2,593 children and young people with an education, health and care plan in the East Riding. That is set to increase to over 3,000 by 2023. That would make us an outlier in terms of the number of children and young people we had as a percentage of our overall pupil population. Over the last 3 years, we've seen a 42% increase in the number of plans issued. Requests have increased by 18% in 2019 compared to a regional increase of 11% and a national increase of 10%. 2020 was not a typical year, but we were tracking at about 11%. Now, as schools have never been closed, but as schools have opened to wider numbers of children and young people, we're starting to see that climb again. Statutory compliance has improved to over 95%. Annual reviews, it's an improving picture. 53.6% of reviews are meeting the 4-week deadline for the local authority response, and that's a summative of January to April, and 69.4% of plans are being issued within 8 weeks of the amended draft. I think when I joined you 6 months ago, we were tracking it around the 5% level. So things are heading in the right direction, but we're clearly not in a position where we're able to report, the figures that we can report in relation to statutory compliance. But it is an improving picture, and I think those teams have worked exceptionally hard to get us to that point. So in summary, measuring success, we've looked at some key performance indicators. So we can look at need, and we can say that SEN support is below regional and national, but EHCPs are broadly in line. Statutory compliance is significantly improved. Disagreement resolution is above regional, but it's below national, and we know that it will only be, we'll get to a position where we have very few things going to tribunal when the whole system is starting to shift in its approach. Demand, sufficiency of places across the graduated offer is not in line with regional and national. And I think that is particularly evident for children with social, emotional, mental health needs, which I'll come on to in a minute. Spend, East Riding is the 3rd lowest funded local authority in England. Our high needs funding that we're allocating is lower than regional and national, and our current high needs block deficit is heading towards the £6 million mark. It will continue to climb if we do not address the very significant issues we have about sufficiency of provision and achieve that ambition that's set out in the kind of statement of vision, which is about children being able to live and be educated within East Riding. Outcomes for children and young people with SEND are educationally better than the regional and national. NEET are higher and an area of focus, and EHE are higher and an area of focus. So there are some of the harder measures in terms of key performance indicators. I think we can also measure success through satisfaction and confidence. Satisfaction, as I indicated in the preamble, it takes time to kind of feel that people can see that we're heading in the right direction, and they start to see and feel the impact of those changes. Satisfaction, we will use the parent carer survey as a baseline, but we also need to create opportunities to ensure that everybody who is supporting families with SEND, and every one of those 6,500 families that are referred to at the beginning, are able to make their views known. And we're using a variety of tools to do that. And the local offer has to be front and centre as one of the things that we use to gather satisfaction and views of parents and carers. Alongside that, because they are equal partners within this, is the satisfaction of children and young people. What does it feel to them? How is the system changing? How is it impacting on them? How are we able to capture their satisfaction and confidence within the system? So working with the Tyler group, so the young leaders of East Riding, how can we develop a satisfaction survey that is also part of the local offer that children and young people can contribute to? Confidence of special educational needs coordinators in schools. So we will be undertaking an annual confidence survey to benchmark where they are now. And then when we have continued to further implement elements of the plan, what impact that has had on their confidence levels around identifying and meeting need. And this is all premised on welcoming feedback and acting on it. The local offer does offer that platform, an opportunity for parents to feed back through. And also I'll talk through a number of parental engagement sessions that we've actually put in place. So in terms of the development and improvement plan, there are many stakeholders within this, and the improvement plan has consolidated all that existing activity, and it has formalised it into a kind of roadmap, a direction of travel, however you want to describe it, moving forward. And part of what has happened with that is that it's been on a stakeholder journey. So I've been round to a variety of organisations and spoke with individuals and refined the content of the plan. So sense checked it to say, do the things that are in the plan, are they the right things? Is there anything in there that we think shouldn't be in there? Have we missed something? And it has been an iterative process. So it can continue to be added to. It hasn't finished its stakeholder journey. Not all the tabs on here are complete. So if there are any stakeholders that feel that they have not had their opportunity to comment, engage, and add their views about the development and improvement plan, there's ample opportunity to continue to do that. It won't close off as a plan because I said at the beginning, it's a living document. So we need to continue to, through that kind of insight process, add into the document. And it has changed. So I think the kind of the initial stakeholder meetings that I probably started back in December, it's changed over that period of time and been refined as more people have made their views known, and they've been added into the development and improvement plan. So it creates a SEND roadmap. It's a 10-point plan. People have said, can we shoehorn point 11 in? No, we can't, and I'll come on to that in a sec. But we can add in additional goals and additional action points under the 10 points that are in the plan. It is about a direction of travel. There are some things that will impact on that direction of travel. Capacity is one of those things. So I'm in the process of putting together a business plan to say we have utilised the capacity that we have available to date to get us to this point, but to actually fully implement all the things that are identified in the plan, we are going to have to invest in some additional capacity to move this forward at pace. COVID hasn't gone away. It's going to be with us for the kind of indefinite future. And I think we just need to be really mindful of that. The area SEND inspection will happen, will trigger at some point. The roadmap won't change. We still need to be really clear about our direction of travel, but we might have to add further things in to that direction of travel as a result of that area SEND inspection. And as I've already indicated, this is about continuous insight and refining this approach. But we need to be really clear how we're collectively trying to move this forward. So we have a plan on a page, and there are 10 points in the plan. And it's really important whether I am having a conversation with children and young people, members of staff that work in specialist services or in social care or in education or in adult services, our stakeholders across health with parents and carers, that we're able to understand that plan on a page approach. So there are a series of symbols down the left-hand side, and there are 10 points in the plan. And the text on the right-hand side describes what each of those points mean. So the idea of a plan on a page is really important. Sometimes people want just the plan on a page, but actually the activities that sits behind this runs to many pages, and I'm just going to go through that in more detail now. So I think I've broken every rule in terms of preparing something for scrutiny in terms of the use of colour. It wasn't intentional. I just, I think it's just a visual way of representing it. Right, I'm going to stop sharing this part because I want to show you the dashboard, but I'm just going to talk through data, and then I'm going to move out of this presentation to show you the SEND dashboard. So in terms of point 1 in the plan, it's not a linear plan. A number of pieces of activity need to run concurrently, but we are trying to ensure we've got better data to help plan what we need. So to be really clear that we've got accurate information about needs that will enable us to determine amount of services to meet need, which is as local as possible. It's also about making the SEND system easier to navigate so that everyone can get the right help and support in a timely way. And so the point is better data to help plan what we need. There are a series of goals that sit under that point. The first goal is a data dashboard. So to develop a data dashboard to provide clear performance information and data to inform effective service improvement, planning and delivery, and establish a quarterly reporting cycle which informs key partners. On the right-hand side of this plan, it has, and I played about with this, we've got a diagnostic, plan, do, review. So if we've undertaken the initial diagnostic, we've started to plan, and remember we didn't start with a blank page, and we're into the doing. It's indicated where we are. We're not into the review phase of this. The second goal within here was to develop a multi-agency dashboard. So to consider the development of a multi-agency education, health and care SEND data dashboard to support strategic commissioning and service planning redesign. and also in developing the marketplace in terms of ensuring we've got sufficient providers available across the system. And we've done some diagnostic work to identify why we need that, and we're partly into planning that. Underneath each of the goals sit a series of actions. Now I've just screenshotted parts of the plan just to kind of give you an indication of how this has been laid out and how it will be performance managed. There are many actions that sit under each of those goals. So it talks about identify capacity to implement the development, gap analysis tools, gap analysis reporting, develop the dashboard, consolidate current reporting into a central hub, audit current reporting capability, which contributes to specialist services, implement quarterly reporting cycle, consolidate key performance indicators for SEND. There is a start and an end point for each of the action points. There will be a lead identified for each of those points, and there's an inbuilt Gantt chart which kind of says how much progress has been made, which will inform that quarterly reporting cycle. Right, I'm just going to stop sharing, and I'm just acutely aware of time. I'm going to actually navigate onto the Send SharePoint, if that's okay. Can you just indicate if you can see what I've just shared?
No, Ronnie, you're still on the. Oh, he's gone now.
Okay, I'm going to navigate onto this site. Can you see this?
We can. Yeah.
Okay. Now you won't have this on your slides because this is the. I've just gone straight onto the interactive dashboard. Okay, so I just wanted to illustrate this for everybody. Okay, so members may be really familiar with SharePoint, but so forgive me if you are, but SharePoint is a way of giving structure and allowing effective management of information and knowledge and intelligence, which informs planning and performance management. It also provides us with an opportunity to curate information to promote organisational learning and development aligned to a shared vision. So I just wanted to take you through the SharePoint and where we're up to with this. It's also a way of actually reducing entropy within a system. So if we've got a degree of disorder or randomness in a system, and I think one of the things that I certainly have had fed back to me from parents is that they don't find the system easy to navigate. So I think it was really kind of critical to understand how were we supporting all our different service areas to understand the context that they were working in, what we're asking them to do, how we were supporting them to do that job well in terms of continuing professional development, and then how we performance manage that. And I think one of the things that I've certainly experienced in other authorities is we try and performance manage without being really clear about what the ask is, and then making sure people have got the right skill set to deliver on that ask. Because we need to do the first two parts of that in order that we can effectively performance manage. So the Send SharePoint is creating a curated framework to enable the Send system to operate more seamlessly. So I'm just going to take you through this reasonably quickly. So can you see it reasonably well on your big screen? Yeah, okay.
Yes, we can.
Okay, so SharePoint is an application of Microsoft 365. I do not have shares in SharePoint, but actually it's one of the better systems that I've used to do this. So it's got, I have my own personal SharePoint, and only I have permission to access that SharePoint. This SharePoint has permission levels set for different people. Now I'm going to show you some of the high level data. It will also drill down right to people level, which I can't share in a public forum. It has an inbuilt news section. So all the teams within in relation to SEND can see that the SEN2 EHCP data was published by the DfE last week. It's got a little bit of information there about the St Anne's School and Sixth Form College topping out ceremony. And it's got a news item there about ICT hardware supply chain. It's got an inbuilt calendar so that everyone can see what things are coming up. We can also build in things like the SEN2 return is going to be done, or some of our statutory returns to central government. It also has contextual information here that may be relevant to the teams working across the SEND system. So I'll navigate across to the CCG information, and we might then be able to go straight to improving health and wellbeing in Bridlington. So it enables that information to be to have a single point of access. So instead of trying to hold training sessions or to send multiple emails, we actually curate a system that enables people to have the right tools at their fingertips to do the job well, and also enables managers to effectively performance manage this system. So there are a number of things that it can navigate through to. In terms of, it also contains the framework, the contextual framework which we work within, and the legislative framework. So it will take the SEN officers directly to the Children and Families Act, and if they're unsure about which part of the Act that they are working within, can check it, and it's there and available for them to do. So, okay, so children and young people in England with special educational needs, you know, if you want to identify which children we should be working with, it will take you straight there, and you can just check the legislative context, which I think is really important, because all the decisions that we take are grounded within the Children and Families Act, SEND regulations, and the Code of Practice. So that framework's there, and really easy and navigable for everybody. So you're not having to save things in folders that then only enable you to see the part of the activity that you're working on with that child or young person. It also takes you through to high needs funding, because that's how we fund provision for children and young people with SEND, and it will take you through to some key documents in relation to funding. Now, I'm just going to show you this one, which I know colleagues may be aware that a number of authorities have been provided with some additional support in relation to their high needs block deficit. All right, I'm going to have to sing whilst it loads. And we've just done some comparative work with some of the authorities that have received that high needs bailout. So Hammersmith and Fulham, Bury, Richmond upon Thames, Stoke-on-Trent and Kingston upon Thames are the 5 authorities that have received £100 million in high needs deficit bailout. And how do we compare in East Riding? So we are very much at the bottom of that group of authorities that have received that type of assistance. So actually that helps us to be able to challenge back and say, actually, we want a conversation about East Riding and why we are the 3rd lowest funded authority in England, and how we compare with these other authorities that you have provided financial assistance for. So it's just all there at the kind of touch of a button, really. What the system's also able to do is to, it will outline what needs to be in the plan. So I think another thing that has certainly been fed back to me from families, but also from schools, is how are we moderating the approach? How do we make sure that we have got something that's fair, equitable and transparent for all children and young people across the East Riding? So this system is providing that context for how we want this work to be done. And the messaging is the same to everybody. So it is not reliant on individuals. This system, you know, so I talked about, I've got my own SharePoint system. So if anything happened to me, then whoever picked up after me could go and see exactly where work was up to, what point we were in a process, as opposed to having to go through shared folders. So it's another way of kind of curating and organising the information. It explains in a step-by-step approach what each parts of that plan need to include. It has a section on education, health and care assessments, and for example, if we were naming a school, I think, again, there have been inconsistencies across the system in East Riding. So again, this takes people through how we consult which schools, and also how this interfaces with our transport procedure. So we are making decisions that are innately moderated because we are following the same process. So this will take you through to a kind of school catchment map. It will take you through to our specialist provision information, so you can ensure that we are placing children in the most local provision that is able to meet need to where they live. And it kind of interfaces with the transport colleagues, and it will, and I think the other thing it does is we should be placing children with an education, health and care plan in schools that are good or better. Now, clearly, some schools go into requires improvement whilst you have children in there, but this enables you to go in and check every school across East Riding. It will tell you how many education, health and care plans they have, what percentage they have, and what their Ofsted grade is at last inspection, and the numbers of children that we have on roll. And that assists that team in kind of applying rigour to the process.
Ronnie, I'm just conscious of time. How much more of the presentation have we got to go through?
Quite well. I really will whip through it. I'm just going to show you the dashboard, and then I'll go back to the main presentation, Chair, if that's okay.
Yeah, thank you.
So we said, in terms of a dashboard, we would develop a data dashboard for East Riding. So it's by no means finished. We're still adding to the data dashboard, but I think what I wanted people to get a sense of is a flavour of where we were 6 months ago and where we are now, and how things have moved forward, and how this enables us to kind of monitor impact. I just kind of quickly want to share the sufficiency tab. I won't share all of this. There's a lot of it, but I think in terms of sufficiency mapping, so one of the things in the plan is about ensuring we've got sufficient provision in the right place to meet need. So we developed a sufficiency mapping tool that enables us to see where children are, so where need is, and then to look at where our provision is and where the gaps are in our provision. So this is all children with an education, health and care plan in East Riding, and you can start to see the groupings of children around the Goole area, Driffield, Bridlington, and this is kind of Beverley and its outskirts. And I think the tool on the right hand side, and I will be very quick, enables us to see where the provision is. So it enables us to see where our specialist provision is, and then to determine whether we've got the right number of places in the right parts of the authority. And so that really is informing those developments around sufficiency planning and what we need to develop across the East Riding. It'll enable us to look at certain cohorts of learners, so we can say, okay, where are all our SEMH children? Where's our SEMH places? And it will kind of identify where they are. And that enables us to really apply a rigorous evidence-based approach to our sufficiency planning, which we've not been able to do in this way in East Riding previously. So I think that's kind of really key. Right, I'm going to close that down, and I'm going to move back to, I might need to stop sharing to reshare again. Okay. Oh, not too many things open. Okay. So I'm not going to come out of this to go back to that dashboard, but I wanted people to see we didn't have that 6 months ago, and that is significantly making an impact on how we're able to determine what we need, where we need it, and what our performance is. I'll talk through data. Developer Service Intranet, that's the site that I've just shared with you. So we are certainly into the the delivery of that. Governance is point 2 in the plan. So checking everyone is doing what they should, making sure there are really clear checks and balances across the SEND system, and that what we're doing well is recognised, but things we still need to have in view. There's a clear plan in place to action these in a timely way. So for each of the goals in the under the governance section, there's a impact measure in terms of where we're up to. I think the thing I particularly wanted to mention around governance is what you can see on your screen is our current SEND governance, accountability and leadership framework. The proposal is that the SEND 0 to 25 board becomes the SEND Development and Improvement Board, which will be chaired by Caroline Lacey, the Chief Executive, for the first 12 months, with a refreshed and refocused terms of reference. Clearly, there is also lots of activity going on around our Children's Trust Board to look at reconfiguring that into a Children and Families Partnership Board, and the SEND Development and Improvement Board will feed up to that kind of new and refreshed Children and People's Partnership Board. In terms of within a series of focus groups that are we have a specific co-production group, information and access, participation, engagement, preparing for adulthood. Now, there were strands of activity that came out of the 2019 Peer Challenge. So the proposal is that we refocus those groups to ensure that they are cognizant of all the parts of the development and improvement plan. So some of those groups we can move into. Some of the areas we don't feel there's a specific group in that's available at the moment, so we need to kind of configure that. So you can see here under finance, I've been to Schools Forum, and we have developed a task and finish group that will look at how our banded model, so how we fund children and young people with an education, health and care plan, and how we spend our high needs block across the system. So there will be some reconfiguration of the governance arrangements. Voice, so making sure we can hear the voice of children and young people, and it's at the heart of everything that we do. Making sure that we understand, you know, how we work with children, parents and carers, and we're working in partnership. So there's a series of goals that sit under here. It talks about refreshing the local office. I'm really keen to understand how accessible our local offer is for children and young people and parents and carers, and young people will come up with loads of ways it can be more accessible and more relevant to them. Pilot a video project to explain the education, health and care process in the words of children and young people. Looking at supported internships for children and young people linked to children and people's participation. You know, East Riding Council is a big employer, so you know, we need to look at how we can provide opportunities for children and people with SEND in terms of employment. Moving some of our activity into a single point of access. I'm not going to call it a front door because I think that's confusing, but I think what families have told us is that they don't find it easy to get information and they find the system complicated to navigate. So the single point of access that wraps around the local offer and parent and carer and children and young people's engagement is really kind of critical to this. We've implemented a series of family engagement sessions. So there's families said, we don't know who you people are. And so starting with a, please, meet the team, meet who these people are who are involved with you on your journey. And they are happening monthly. And I think there are opportunities to add further engagement sessions in to that process that's there. Reviewing how we engage children, young people, I think is one of the key kind of areas, and co-production. So we do have a co-production, the 4 pillars of co-production, which has been co-produced with parents and carers and children, young people, and we want to strengthen that co-production across the system. I've already talked about briefly the annual parent carer survey to capture feedback and then to measure satisfaction across that whole system. Right, I'm really going to speed up. So in the plan talks about engagement, so how we engage. So I think we've had feedback that people are asked about things, then they don't always know what's happening. So there's now a clear page on the local offer that will inform about that. The other thing to add is that all minutes from any of the subgroups will be made available onto the local offer. There will also be a summary, because some people do want to look at the level of detail that are contained within minutes. However, some families don't, and some children and people don't, but actually a summary of what was discussed and what the actions will be available through the local offer. Finance, I've touched on this. We've got to ensure we're getting enough resource into East Riding, and we are directing our resources proportionately at the right parts of the system in order for us to effectively meet need. We are spending a lot of money out of authority, and so the ambition is to spend that within East Riding. There is absolutely no reason why we can't, for the majority of our children, be making that provision within the East Riding. And I would much rather be spending the amount of money that we're spending out of authority creating and supporting the local economy in East Riding. The impact that will have on travel time will also be significantly reduced if we can get that provision as local as possible. That very much links and interfaces with sufficiency, so ensuring we've got the right number of places across the system, so we can, and that's right from a child's earliest years right through to adulthood, and it's as local as possible. Now, I think people have said, what do you mean by as local as possible? I know we've not had time to do it today, but there's some very detailed analysis looking at travel times for our children and young people across the East Riding, how far they're having to go, how many miles a year that they are travelling around the authority, and that will be presented as part of that sufficiency plan. Integration, so I think I've had some really positive meetings with our stakeholders, particularly our health colleagues, around joint commissioning arrangements, making sure we really clearly understand what we need to do as separate organisations, but what we need to do together and collectively to get the best outcomes. And that is where some of that creativity comes in. So where we're paying for very expensive packages within health or within the local authority, are there opportunities to do that differently and create a better service for those children and families that is integrated and locally provided. Journey, that talks about the journey from birth to adulthood. So how do we support transition through the SEND system, right from birth, right through all those key phases and between children's services and adults, and particularly that transition from children's to adults health services. So that kind of outlines the kind of ambition and goals in relation to that. Quality, across all of this, we've got to ensure that we performance manage and quality assure everything that we do to ensure that we've got the right checks and balances in place to be able to evidence high quality, evidence-based and outcome-focused work. So there are a number of goals that sit under there. Workforce, it doesn't look like there's much in there. It's massive. So making sure we've got the right staff to support children and young people who are well trained and who are experts by experience within their field. So right from children's very earliest years, those practitioners need to be experts by experience in early childhood development. It's that period in a child's life where we are trying to establish what's happening. There might be a clear diagnosis, there may not be. And it's about making sure we've got a really clear integrated specialist teaching and support offer right across the graduated offer to support our SENCOs to meet a wider range of needs, to provide them with the skills and interventions to build on what they have, but to enhance that. So we've got a really comprehensive, universal, targeted and specialist workforce offer for our schools and settings across the East Riding. And that we've got a confident workforce that is able to identify and meet need in a timely way. The review and implementation of the improvement plan, it's an ambitious programme. This plan will go to full cabinet and we were hoping that that might be by summer term, it may be by the autumn term. It will also go through the health equivalent process in terms of ratification. We are hoping to have a final plan and agree that kind of ongoing implementation from autumn 2021. But some elements of this activity are already into the implementation phase, and that's why it's got to be a living document that we continue to add to. Okay, and then I was asked to just update Scrutiny on any outstanding actions from the meeting in January and October. So there were a number of actions. Now I think these actions have been integrated into the SEND Development and Improvement Plan, but I've just added this additional information at the end to kind of brief members about what progress has been made. So we talked about co-producing information about the annual review process. So that's in train with the information group, and an annual review page will be added to the local offer by the end of May 21. We talked about undertaking a data collection and cleansing exercise. I really am not an advocate for data cleansing. I think by the time you've carried out that activity, your data's already needing to be re-cleansed. So I think the approach that the dashboard is taking is ensuring that the data is inputted correctly in the first place and investing our energies in ensuring that happens so we don't have to continually cleanse the data. And I think that's really important, and that will be addressed through the dashboard as a strand of activity with performance. All transition phase reviews to be completed and plans finalised by statutory deadlines. All the transition phase reviews were completed by statutory deadlines. We weren't in every case able to name and specify provision, but in the vast majority, over 90% of cases we were. All posts for review echoes to be recruited to and officers to have completed induction. All posts were recruited to. We currently have one vacancy due to somebody leaving. The identified backlog of plans requiring amendments to be completed by spring 21. Focus to then shift to improving performance with regards to timeliness of the wider annual review process. I think it's become really apparent that focusing on backlog is creating a challenge with getting the annual review process statutorily compliant moving forward. And I think I'll pick this up on slide 19. So there is something for me about we can use our capacity to retrospectively amend, or we can use our capacity to ensure the system is compliant moving forward. And so I'm happy to take any questions at the end about that. Develop and roll out training on how to hold a good quality review. So that has been delivered at the spring term cluster meetings. There's a further mock-up session being organised. A survey was completed by Senco's providing feedback and what further training they require. And the training programme is being produced and will form part of Strand 10 within the Development and Improvement Plan. We talked about develop a framework for annual reviews for schools to improve the quality and consistency and format of annual review meetings across East Riding. So we provided an update in January in relation to that, and the same for the annual review track changes pilot, which we provided that update to January overview and scrutiny. Okay, I really have worked through those. Any questions?
Thank you, Ronnie. I think if we give members a 2-minute break just before we move into questions, please. Thank you. Or not. Do you want to just get on? Let's get on. Right, perfect. That's decided. So I've got a list of questions in front of me. Councillor Steele, I'm going to bring you in first because I know that you've got to get off.
Thank you, Chairman. And I don't want to hog the whole system. I do have 3 quick questions. First of all, just to comment, that it's good to see a large proportion of the SEND children remaining in high stream schools. That's good, mainstream schools. So the first 2 questions, Ronnie, should only take 1-word answer. Is the voice of the children and young people included in the stakeholder group? And how many children have placements outside the area currently? And thirdly, the high proportion of East Riding requiring EHC care plans. Now, is this due to increased awareness in the population? Is it overdiagnosis, or is it a true higher prevalence?
Okay, so the first question was, are children and young people's voice part of the Development and Improvement Plan?
That's correct.
Yes. So is that
yes, it's good. Yes, it's good.
Okay.
That's okay. Move on.
The second question was, how many children and young people have we got being educated outside of East Riding? I think Councillor Steele, sorry.
Yes, that's correct.
Okay, I'm just going to check the exact numbers that we have been educated outside. So if you just bear with me a second. So I'm giving you as up to date as we can possibly have it. Okay, so we have 201 children and young people out of authority, not in Hull. Hull, we have 230 of our children with plans. So, and in East Riding, 2161.
Quite high to me, but there again, I'm quite new to this committee. And the other one is about the prevalence in the East Riding.
So do we think that is disproportionate? No, I think what's been happening across the SEND system in East Riding is it's been catching up. So I think in relation to those initial couple of slides that are demonstrated, I think we are below identification for SEN support and broadly in line with our EHCP numbers. If we increase to over 3,000, which if we carry on at the rate that we are doing, we will be over what I expect to see across the East Riding. And that kind of move for children being progressed up the SEND system, I think is part of what the plan is trying to address, which is we need to capacity build within mainstream schools. We need to get the resources to the right part of the system in order to meet need effectively. So we don't see this escalation up into more specialist provisions.
Okay, thank you, Ron. Thank you, Chairman.
Thank you, Councillor Steele. Councillor Nickerson.
Thank you, Chair. Thanks for that update, Ronnie. I was going to nearly say brief update then. Thank you for that update. Okay, one of the underpinning principles that that was identified in that report is co-production. And I know there has been various sessions with stakeholders, with the Parent Carer Forum, but as of today, the chair of the Parent Carer Forum has notified members that they don't believe that this is a co-produced improvement plan. Now, that's a worry. And I'm sure everyone will agree that we don't just need to listen to parents and to stakeholders, but parents need to feel that they are being listened to, and we need to do a better job demonstrating that. So my question is, do we have the resources to very quickly correct that?
Okay, so in terms of what we mean by co-production, I think there is further work to do to ensure that we're all on the same page by what we mean by co-production. There isn't anything in the Development and Improvement Plan, and I met with both the chair and the deputy chair of the Parent Carer Forum on Monday, and where they confirmed that there is no content in the plan that they have not been involved with co-producing. And I think we need to be we need to have that discussion further around content, so substance of what's in there, over the presentation of the slides that you have received as members today. Now, the Parent Carer Forum had sight of the presentation that is being delivered, has just been delivered to you. No, they didn't write those slides, and nor is that appropriate. So in terms of how that is actually presented, the content they're saying has been co-produced. So I think I'm really, and I said to them, I'm really keen to understand what element of that you don't feel has been co-produced. And they said, we don't think there's anything that has not been co-produced.
Thank you, Chair. Just to come back. So I think my question was, do you have the resources to address this quickly? I'm assuming that we do, but I just do need to press the point, because we need to understand this, is that the chair of the PCF does not believe the content has been co-produced. I can forward the correspondence directly to you on that, but I think it's vital that we take a step back and understand that that is the case, that there's a mismatch here, either with expectations or communications that does need to be quickly addressed. And I want to be confident, and the committee wants to be confident, that we have the resources, and you, Ronnie, have the resources at your disposal to look at that and make sure that that can be corrected. Whatever the gap of understanding is, that's going to be looked at.
So my response would be yes, but I think I also want to kind of come back to what I said at the beginning. We've got 6,500 children and young people with additional needs across the East Riding. The Parent Carer Forum is one set of stakeholders. There are many stakeholders, and we need to hear the views of all of those stakeholders. And the strategies that we've been put in place around engagement through the local offer, through the meetings that we are having on a full weekly basis with parents, provide an opportunity for parents to be engaged further within this process. The Parent Carer Forum, following the meeting on Monday, need to consider whether they are happy with the conversation that I had with them on Monday, and can provide their support and co-own the SEND Development and Improvement Plan.
Thank you. My second question was, thank you for that. The one thing that you mentioned was that the plan is a consolidation of all of the other improvement activities that's happened, in the past. I suppose my question is, of the ISOS improvements, the 8-point plan from, I think, 2018, has an assessment been made of those improvements, and has that learning been put into this this 10-point plan?
Yep, so it consolidates all the activity, as I kind of indicated. So outstanding actions from the 2014 reforms, and there are some statutory things that, whether people felt they wanted them in an improvement plan or not, statutorily we are required to do them. Plus the ISOS information, the peer challenge in 2019, the activity from all of the focus groups, the parent carer survey from 2018, the version from 2020 has all fed into the content of the plan. And what I also have to say, Councillor Nickerson, is I made it really clear that this is a live document. It is not, it's a living document. So we can continue to add into that. And at every step of the process, every stakeholder group that I've engaged with, there's been opportunity to comment on what is in there, to understand that has been, so the presentation that I've just delivered for you is not different to the presentation that I delivered to the annual general meeting of the Parent Care Forum in February, and I've delivered to all of the stakeholder groups that I've engaged so far. And I've said it's not at the end of its journey. If there's anybody who feels that they have not had an opportunity to comment, to make their views known, there is ample opportunity still to do that. So yes, it includes that activity because I've reviewed it all as part of the diagnostic.
Are you finished, Councillor?
I'm finished. Yeah, I might come back with a recommendation at the end. Should I wait till the end, Chair?
Yes, please. Thank you. I've got Councillor Healy next, please.
Thank you, Chair. I think this meeting would have been a good opportunity for those voices to have been heard. And indeed, that was the original plan. And the former Chair of Overview Scrutiny, my respected friend, said in an email to to users, back at the end of last year, I quote, Councillor Weeks extended an invitation to OMC to attend the meeting scheduled for April and May. It was also agreed by OMC that officers from all tiers, from the CEO to the service providers, be invited, and that service users also receive an invitation. Now, clearly, service users have not received an invitation. I'm not going to go into that, but it has rankled with them. Now, Ronnie's very comprehensive 10-point plan has within it point 3, voice. And I want to talk, I just want to mention voice. And this isn't meant to be a speech, folks. But point 3 says we need to make sure that we can hear.
Councillor Healy, I do apologise, but this isn't a forum for a speech. Have you got a question?
It is not a speech. Well,
it is a speech. You need to ask a question.
The question is, why have the voices of the families who wanted to be here today, why have they not been listened to? Because their voices, in which they are saying really, really strong things about they're saying there's no empathy, they're saying it's dysfunctional, they're saying that we do not walk in their shoes every day, yet we have the power to change their lives. They say we are human people, families, siblings, parents, and service users. We are not statistics, we are not numbers on a piece of paper or on a fancy PowerPoint slide. They have not been listened to. So if you want it in a question, the question is, why have they not been listened to? Why have they not been engaged here today? And whatever we agree today, and I hope and will support what Councillor Nickerson says, that we give them a strong, robust platform. That if they think they're not being listened to, they're not being listened to, period. Thank you.
Thank you, Councillor Healy. I've got a hand up from Owen Rush. Did you want to come in and respond before we hand over to Ronnie?
Thank you, Chair. I think I would just make the point that peppered throughout the presentation that Ronnie has made is an absolute clear commitment and demonstration that the plan we're talking about today is not a single local authority or Ronnie plan. It's a plan that has tried and I think has drawn on the voices, not just of the parents that have been referred to, but many, many parents, children and young people, but also a variety of stakeholders whose involvement in this is absolutely essential if we are going to do two things. One, deliver on our statutory responsibilities to these children and young people equitably and right across the local authority in a way that's both sustainable, is forward-looking and long-term. And two, if we're going to have a system that is absolutely transparent and open to people. There's three, I think, unique features to the plan that Ronnie's presented. One is a commitment to publish openly the conversations that take place, all of the conversations in relation to parent care reform, local authority interactions, but also all of those groups that, if you like, make up the subsets of the plan that's been presented today are intended to be groups comprised of everyone who has a stake in this plan. If the plan isn't owned in that way, it becomes a single agency or a single person's plan, and of course it won't succeed. So there are huge stakes here, both for the children and young people that we serve, and for the ability of the system to do that well. And that's why the plan, as it was presented today, tried to map right across that stakeholder group the absolute critical importance of engagement and inclusion of everyone. And I would, challenge the kind of comments about empathy. I think the plan is absolutely soaked in a kind of an empathetic understanding of what we've heard, what people are telling us, and how we want to approach this work going forward. So apologies, I'll hand back to Ronnie.
Thank you, Owen. Ronnie.
I don't think I have anything else to add, Councillor Weeks, on that point.
That's fine. Thank you, Ronnie. I've got Councillor Johnson next, please.
Thank you, Chair. Ronnie, you mentioned that we're getting to grips with the annual reviews and meeting the 20-week statutory requirement for EHCPs, but the annual reviews you're still trailing behind in. So, I mean, certainly the comments that I tend to get from people, and I'm sure all of us get comments from people phoning us up saying, my annual review still hasn't been done. Could you throw some light as to why we're still struggling with those annual reviews, please?
I think that is, thanks, Councillor Johnson, that is a national issue. I think, and what I demonstrated in the presentation was a clear improving picture, and that compared to 6 months ago, we have significantly improved that picture. I think I also referred in the last slide to perhaps what had been asked was that people would retrospectively use capacity to address annual reviews that were out of date. I don't think that is the most helpful way of managing this, because we need to make sure we've got the right capacity to resolve this moving forward. And if we keep retrospectively trying to look at things, we are using capacity and we never kind of catch up with where we need to be. I think the thing for me also is a really comprehensive analysis of why we have amended annual reviews. So we've got to have a process which writes outcomes in plans that have longevity, that are end of key stage outcomes for children and young people, and that if we are spending time amending plans based on changes in wording, and we have to go through the full statutory process to do that, that is not the most effective use of that resource. Now, I know that people may say, well, actually, if people have got a view about a change of wording, if there's much right to have it changed in their plan as anybody else. We've got to be really clear that the process is to review the outcomes and the progress made against the outcomes identified in the plan. That is the purpose of the annual review. And we can make a decision then whether to cease to maintain or to amend the plan as a result of the annual review process. So I think there's been a whole, what we've been trying to do in East Riding is to amend everything. And actually that is not the right approach. So I think there's a little bit of, absolutely, there's frustration within the system where plans have not been reviewed in a timely way. And we need to be clear that, and I've given the services permission to ensure that they target children that are transitioning. So those key stage transitions between primary and secondary, they have to be the priority, because we have to be consulting on up-to-date information. And that there are some plans where children are not transitioning, that we've just got to sequence the activity differently. We have a reasonable amount of capacity, but we could double it in order to address all the backlog of annual reviews that we have across the authority. We've got to get to a position where we say, from this point moving forward, this process has sufficient resource in order to enable it to happen. And at the minute, we're spending some of that trying to retrospectively correct challenges of the past, which are really important to those families, but actually, how do they impact on outcomes for the children and young people?
Thank you. Yeah, that's very fair comment. I think people just feel that they want to be listened to, and most of the comments that I tend to get tend to be for the 18 pluses who feel that they haven't got a clear plan going forward. So I look forward to seeing that being addressed as we move forward. May I ask another question? Thank you very much. It's about OLAs, really, just building on Councillor Steele's question. How much does that cost us? It must be a huge amount of money. And as a supplement to that, are there a group of people within that who could perhaps be better provided for by building better provision, for example, actually in the East Riding?
Yes, so we spend in the region of £4.5 million out of authority. That will increase by around £1 million a year, which will add additional pressure into the high needs block if we don't address the sufficiency within East Riding. So very much so, we should, apart from children with very complex levels of need, who perhaps have needs where there's only a particular provision in a certain part of the country, that we'd still need to access out of authority. But for the vast majority of children and young people, we should be able to provide that locally. I've got to put together the sufficiency plan to actually present that, because that will require an investment. So we will have to invest in order to enable that provision to be made locally. And over time, we'll start to see a decrease in the amount of resource being spent out of area.
Do you know when that plan is going to be ready, Ronnie, when you'll be able to bring it to the committee to look at?
Well, I guess in terms of sufficiency, what I have tried to demonstrate this morning is where we are up to in that process. And so there is further work to do, and then we need to present that full strategic sufficiency plan through the appropriate kind of committees in relation to where we're up to. I think we're not talking about a quick fix with sufficiency. There are some things that we can do in the short to medium term. Some of the larger items that I think need to be in there are part of a 5 to 10 year strategy.
Thank you. It's good to know it's being addressed. Thank you.
Thank you, Councillor Johnson. I've got Councillor Meredith next, please.
Thank you, Chair. Can I just start actually by saying, having been directly quoted by Councillor Healy, I just feel I should probably respond. It was always my hope that today's meeting could include as many people as possible, and this is something that I have voiced on multiple occasions. I think I referred to today's meeting as our Super Bowl, our Champions League final back in January. Unfortunately, it was not possible and it was beyond our remit, but as a representative, I can act exactly like that. And I've got a few questions that I know some users would like to hear asked today. But first, just in relation to the presentation, just wanted to say thank you, Ronnie. And I was glad to see that the dashboard included a refresh of the local offer, which is a great tool, but I think it's fair to say historically has not been that accessible or user-friendly. I think it's been likened to the planning portal, which Scrutiny will have to look at some point as well, probably. And also, could I thank you again for actually proof is
Councillor Meredith, questions,
proof is in the
please.
pudding here. The communication has also become engagement and communication, and that was in line to Councillor Nickerson's points. On that note, with engagement, how many appeals are upheld, and how does this impact on influence decision making?
Okay, we're kind of venturing into the realms of being able to identify individual children, and I'm not comfortable about sharing that in a public forum. I think I did present the slide that talks about appealable decisions. I think if we are talking about what impact does that have as a lessons learnt There is another strand in the dashboard, and again, I can't share that with you because it is using pupil level information, child level information, and I think we can't share that. But what I can tell you is that some high profile cases that have gone through the tribunal process have been used to do full case reviews on, to actually inform practice and to look at opportunities where we could have intervened differently at a different part of the process. I think we are also doing some really exciting work on child and young person's journey that I'm happy to bring back to scrutiny at a future meeting. If we can get it to a position where we can anonymise it to an extent that people couldn't identify individual children and young people from that information. In terms of and I said that we are tracking in East Riding slightly above the Yorkshire and Humber level, but certainly below the England average. So we have less cases going through to first tier tribunal. Sorry, Councillor Merritt, if that answered your question.
As much as I expected you to be able to, we don't want to be putting vulnerable children and personal information out there. I just wanted to make sure that, that, as you said earlier, the system was evolving and that as a result of that, improving as well. If I may, Chair, everybody else has done 2 questions. I don't want to feel left out. Thank you. On the going back to communication, I'd just like to know how it's been improved. You know, whilst it's crucial that it's prompt and appropriate with parent carers to ensure that the best service is delivered, I think it's also worth noting that we should be talking about the fact there are 28 stakeholders, and we don't want to see silo working occur, and that this would also be applicable in terms of transition periods. We don't want to see previous efforts being replicated or people having to go through the same thing again year after year as they move from one environment to another. So just trying to group all that into a coherent question. How has the communication been improved and what further steps have been taken, please?
Okay, so we've had articles in, and I'm going to get the name wrong, I don't know why it doesn't trip off the tongue, but Your East Riding or Here East Riding, the document that goes into every family home across East Riding. So there's been an article on the development and improvement plan that's gone into that document. We've got an improvement plan page on the local offer. I think it'd be really good, I suppose, if people who are not familiar with the local offer have opportunity to have a look at it. So I think I'm absolutely hearing what you say. There are ways to ensure access to information is further improved, but the local offer in East Riding is certainly statutorily compliant. So I think I'm really keen to work with children and young people, as I've indicated, and parents and carers to look at, and other stakeholders, because I think it can be a key information point for lots of professionals across the system. The information has been improved on that, on the local offer platform. We've also created and co-produced with Parent Carer Forum a series of engagement sessions for parents and carers. So responding to feedback that we've had about, we don't know who people are, we don't know what the education, health and care process is. We've put a monthly programme of engagement sessions in through the local offer, and they were co-produced with the Parent Carer Forum in discussion with their members about what they're saying they want, and that information is in there. I have somebody engaged almost on a full-time basis, listening to parents and carers, and we've certainly had, certainly at the start of this latest national lockdown in January, we were meeting with them on a daily basis, and then it moved to a weekly basis to ensure that we were putting in place the right support and were communicating and engaging effectively with parents and carers. Also in response to parents and carers saying that they were really struggling with engaging their young people when they were perhaps spending longer at home, for families that weren't able to access education fully. We put in place a series of grants for families to support them at home, and that was administered through the Parent Carer Forum. We gave that grant directly to the Parent Carer Forum to support parents and carers across the East Riding. There will be a podcast. We will continue to make best use of all media channels, because I think there's something about the profile of SEND across the East Riding. It needs to be, we need to celebrate things that are going really, really well. So I think the thing that I showed you on the SEND data dashboard, where we have articles that have gone into the media, such as the topping out ceremony at St Anne's, in terms of the new St Anne's special school development. That's all part of that engagement strategy and approach, alongside the co-production group that Parent Carer Forum are a pivotal part of, alongside the Tyler Group. I think that's some of the examples of how I think we've improved engagement.
Thank you, Councillor Meredith. I've got on Zoom Andrew. Please.
Thank you, Chair. Against a backdrop, obviously, of perhaps underfunding in the high needs block, you identified that was, and an increasing percentage of children in mainstream with educational healthcare plans, and yet higher outcomes against the region, which is obviously something to really celebrate. What's your sense and view with regards to staff in mainstream schools? Are they getting the level of support necessary from the local authority with that backdrop of obviously increasing numbers in mainstream?
So thank you, Andrew. So in terms of the Development Improvement Plan, all this activity is captured in that strand 10 in terms of workforce. So I think being absolutely transparent about this, I think we have some gaps in the offer. We have an offer that is, I talked in point 10 about a really comprehensive specialist teaching and support service. We have some of that, but we don't proportionately have that based on the needs profile for East Riding. So alongside the asks around sufficiency will also be the asks around workforce. And so I think we are delivering on parts of that, but we're not delivering it in the way that I described, which is that comprehensive universal quality first teaching offer to targeted intervention through to specialist intervention. So I think we are supporting our SENCOs. There is a programme of training in place. This is about refocusing all of that and saying there are some gaps in the offer. And so we need to ensure that everybody has done that universal training offer. So being able to identify and put in place dyslexia friendly classrooms, for example. So specific learning difficulties is one of the things that has been flagged as something that perhaps is not being identified at an appropriate point within a child's learning journey. Often our children with social, emotional, mental health needs have undiagnosed specific learning difficulties, such as dyslexia and dyspraxia and dyscalculia. And so I think what we've got is a system that is part the way there, but is not fully there. And the proposal in point 10 is to actually integrate that into a comprehensive specialist teaching and support service. So we provide the right level of support to skill up our colleagues across the school and setting sector with that toolkit of interventions. And at the moment, we're doing some of that, but we're certainly not doing that to the extent I think we need to be doing. And that's why we're seeing a climb into more specialist provision, which is not always appropriate to and effective in terms of meeting the needs of those children and young people. Whilst that being against a backdrop of we're certainly doing something right, because we're getting some really positive outcomes for our children and young people with plans.
Thank you, Councillor Cortish.
Thank you, Chairman. Just a wiggle on that, Ronnie. Following a great question from Andrew and the information we've heard, we know the level of need because of the amount of pupils we have in mainstream. It's a simple question, really. Is the amount we receive from central government to help fund that enough? Is it fair?
No. in short. So I think, no, it isn't. And I think we have to kind of understand how those figures are arrived at. And part of the amount that we have available within East Riding is based on historic spend factors. And so, and we can look at this one of several ways, can't we? That what we've tried to do in East Riding is to be really mindful of the resource that we have available. Despite doing all of that and putting in place, effective checks and balances across the system, we have increased our deficit to almost £6 million. As I've said, that deficit will continue to increase. The high needs system is a national issue in terms of how we fund this effectively. And we've got to get on the front foot. So there are some things that we can do even if central government don't come back with additional resource for East Riding. That is going to require, I talked about East Riding being risk aware and not risk averse. It's going to require, support to enable us to get the right number of places across the system in East Riding, and that is going to require capital investment. That is not coming from the high needs block, and so we've had a tiny, it's around £500,000 we've had for capital developments into East Riding. That is a tiny amount of resource compared to what we require across the authority. So we're always grateful to get anything, but actually we need to be going back to central government to challenge that. And we've already started some of that conversation with the Education Funding Skills Agency around challenging the amount that we receive in East Riding and how we compare certainly to those 5 authorities, but as an example, but not just to those 5 authorities, to other authorities across Yorkshire and Humber. So the long-winded but the short answer is no, we have not got sufficient resource.
Thank you, Councillor Coulter. On that topic, Councillor Nickerson, please.
Thank you, Chair. If any other elected members like me are listening to this and thinking we should be writing to our local MPs and central government in support of this funding arrangement, then it would be really good, Ronnie, if you could provide, or anyone could provide, any more context in written form. Obviously, we've got the numbers, we understand why it's happening. But if any other context could be provided, I think most members would be encouraged to lobby as best we can on behalf of the service, which sounds like it needs it.
Thanks, Councillor Nickerson. I can certainly provide a form of words.
Thank you, Councillor Nickerson. We've got Councillor Smith, please.
Sorry, thank you. Very quick question. When Ofsted eventually come in, where do you think we will be?
Sorry, Councillor Smith, it went very quiet. Now I have to kind of, in the interest of transparency, I can lip read if I can see your face. So I think it was a question about
Ofsted.
Yeah, okay.
Yeah, when they eventually come in, where do you think we'll be?
In terms of that kind of assessment of where we are presenting a really positive picture in relation to statutory compliance. We're presenting an improving picture in relation to annual reviews. I'm not going to I am going to preempt. I think it is highly likely we will get a written statement of action because there's still more to do. And that's where I think we are. So I think I think we can clearly evidence that we know ourselves and what we need to do, and we are part way on a journey in terms of how we're going to achieve that. I think the development and improvement plan puts us in a positive place in terms of we know where we are, we know what we need to do, and we've developed a process to enable us to do that is based on a really clear evidence base. But we've still got areas of work across the system where it's not working as well as it needs to. Therefore, that's the position I think we'll be in.
Ronnie, when can we expect a full inspection with a graded outcome?
It's not a graded outcome in that way, Councillor Weeks. So they will. So back at the start of the presentation, I talked about they'll be looking at how well we identify children and young people with SEND across the system. So that's also about how our colleagues in health work in terms of identification of children, how well early years is identifying need across the population, but also how well and how quickly we pick up children and young people across the whole SEND system. Then what progress those children make, both for children at SEN support and with plan, and then what the outcomes are. So we don't get a graded outcome in terms of outstanding good, requires improvement. It's not that kind of outcome measure. We will get a letter that outlines what we're doing really well, and if there are areas where they feel we are not meeting our statutory duties around those areas, then we'll get a written statement of action.
So we don't
outline what we need to do.
We don't get an Ofsted inspection in the same sense that specialists, that safeguarding services.
No, it's not
different.
It's not that kind of framework that this is under. So it will be a report and a whether or not we've got a written statement of action or not.
Okay, thank you. Councillor Jump, please.
Thank you, Chairman. Thank you, Ronnie. Very interesting report. This is the first time we've met. Just two brief questions. Surveys. We're very good at carrying out surveys. We relish the results, but unfortunately they only come in from a minority number of people. Now there's a lot of our service users who have been ground down. The last thing they want to do or have the energy to do is to complete a survey, because they know in the main that there are going to be negative results for the authority. How are we going to support those people in completing surveys and giving us information, however much it hurts us to read the replies, because we need that information? The other question is Parent Carer Forum, and I concur with Councillor Nickerson's comments. They were invited to a meeting on the 21st of October 2020 to this committee. There was nothing stopping them being invited today. All we've heard is a one-sided conversation. Now, the Parent Carer Forum say that they were never consulted in the early days about what they felt went wrong. Why didn't somebody sit with them, a cup of tea and a biscuit, a blank piece of paper, and say, write it down from your perspective and the service user's perspective, what went wrong? And I hope this committee in the future will have service users and the Parent Carer Forum before them to get the full picture. Thank you.
Okay, thanks, Councillor Jump. Well, firstly, the survey that has been undertaken is not a local authority survey. It's a survey undertaken by the Parent Carer Forum in 2018 and in 2020. In 2020, December 2020, when the last Parent Carer Forum survey was undertaken, I did meet with the Parent Carer Forum, and we discussed co-producing a survey that was jointly co-produced between the local authority and health partners and the Parent Carer Forum. The Parent Carer Forum opted to carry out that survey in December 2020. I made it really clear at the time that we were really interested to hear the outcome of that survey, but that was not a local authority survey. It was a survey of the Parent Carer Forum. They did not want to delay that survey. They felt that members would not be happy about that, and they'd given indication to their members that that survey will be completed in December 2020. My ask was that we co-produce something, and that survey was done in the summer term. However, the Parent Carer Forum are absolutely within their right to survey their members. The expectation, however, is that the local authority does something about the outcome of that survey. Now, I've been very cognizant of comments that have been made during this committee about how we haven't been listening to parents and carers. That is not true. And so I have met with the Parent Carer Forum. I have been to the Parent Carer Forum annual general meeting. I have met with groups of parents that do not want to align themselves with the Parent Carer Forum. I've met with individual parents who want to make their views known. And I have listened to what parents have told me, and I have included that within the Development and Improvement Plan. The Development and Improvement Plan, as I said at the beginning, there was lots of activity in East Riding already. We're not starting with a blank page. The Parent Carer Forum and the views of parents and carers and children and young people have been fed throughout all elements of the plan. They have been involved in every subgroup. And I think as part of the process of we've said we want to be totally transparent, the minutes of those meetings and the attendees will be available on the local office. So people are aware of who's there and who is representing their views. Surveys are one way of measuring satisfaction and confidence within the system. Some of the other things that I've talked about today describe other ways that we'll develop satisfaction and confidence within the system. So the engagement sessions that we've put in place that will happen weekly for families were not available in December. We listened, we've acted on what the request was, and we put those in place. We will review those. I've also answered multiple questions via the Parent Carer Forum through the annual general meeting process that led to something like, it was about 6 pages, I think there were 69 questions that were responded to. So I think surveys are one way of establishing satisfaction and confidence, but there are also other ways, and I've described some of those throughout the committee today. In terms of, you defined it as what went wrong, and that the Parent Carer Forum and other groups were invited to the meeting on the 21st of October. I didn't invite anybody to this meeting. It's not my committee. So I think in terms of any expectation that parent and carers were represented here today, I think we need to look at how those invitations were made. They certainly weren't made by myself. What I did say at the January meeting was it would be opportune when I come back in December to invite a broad church of stakeholders to that session, or we look at establishing what it feels like, what the experience of the changes that have been put in place feel like for children and young people and their families and other stakeholders, because I think there are more stakeholders there that we need to kind of factor in. So I think that's kind of what I'd like to say. We didn't start with a blank piece of paper because that would have been remiss of us. I made it really clear we were building on some really firm foundations, and we're not starting with a blank page. The Parent Carer Forum have been involved with a process over a number of years, and it would have been remiss of me to have not factored that in to the Development and Improvement Plan.
Thank you, Councillor Jump. I think for the benefit of anybody watching, we probably won't take that as a formal invitation to the meeting in December. I think we'll learn from the mistakes we made last time and not set expectations about the meeting in December yet, but we will have a conversation about that in future. Just before, I've got a couple of wiggles on that particular point. Just before we do, with respect, Ronnie, I think it's all about perception. And I know from the point of view of elected members, we have inboxes full of emails from parent carers telling us that the council aren't listening. So it may be that the council feel as though they're listening, but whether that's resonating with the parent carers and whether they feel as though they're being heard is maybe a different story, because I know my inbox is full, and I think I can look at practically everybody around here to say that we've all had correspondence, phone calls and emails and letters from parent carers telling us that they don't feel as though the council are listening. So it's maybe subconscious in the sense that the council think that they're listening, but they're not listening in the way that the parent carers want them to listen, or that it's just they don't feel as though they're being heard. So I think that's an important point to raise before we move forward. Councillor Healy, would you mind if I bring the director in first? Owen.
Thank you, Chair. And just a brief comment. I think and absolutely understand that members will get correspondence and approaches from a broad range of people, and absolutely appropriate. I think what we would ask, though, is that there's an opportunity where those correspondents are happy for us to be able to make a direct response. And I think certainly over the last 3 or 4 months, many, if not all of those where we are aware of, have resulted in face-to-face meetings with individual residents. And just to reassure members that that's not in any sort of conflictual tone or manner, really. I think it is one route into the listening, as has been described, and a really useful opportunity for us. And absolutely picking up Councillor Jump's point, you know, there is no lack of, I think, willingness to hear the difficult messages at all. So really welcome, you know, those contacts, those letters, those challenges pass straight through to the service, and an absolute assurance that we'll sit down with each and every one of those to make sure that we fully understand and hear what those concerns are. A small caveat, of course, is that in any of services of these nature, we probably won't always agree on a final outcome from those conversations, but absolutely recognise that hearing those messages and, where at all possible, working to reach some sort of a compromise or resolution as quickly as possible in the best interests of children is at the heart of this plan, and is at the heart of the culture that I think Ronnie is describing in terms of the direction of travel.
Thank you, Owen. I think it's clear, isn't it, that we need to get to a stage where the parents feel confident enough contacting the council directly without having to come through elected members in the first place. I've got Councillor Aitken, if that's okay with you, Councillor Healy, as the portfolio holder.
Thank you very much indeed. Thank you, Councillor Weeks. Thank you, officers, and thank you, committee. It's been a really informative meeting for me. As you'll appreciate, I am newly positioned in the portfolio holder role. But one thing that I would like to assure members, and for any members of the public who are watching this via YouTube, it's really important that we do get across the fact that we are an open door to have that conversation. I am sometimes concerned that some of the conversations can actually negatively impact on other service users. So I think that there are occasions when it can be very fortuitous to actually have these conversations behind closed doors, and that I would sort of suggest to you as elected members that we actually help to mediate that, and I am very willing to be part of that process. So I do want to assure all members of any political group or it's from any direction that that I will totally, within the best of my ability, ensure that the voices of our residents, which to be fair is the reason why we're here, that the voices of those residents is heard in a correct and timely manner. And I think that from what I watched, very short, I am literally in days into this role, but I am hearing straight away from not only from our director Owen, but also from our chief exec, that this is actually a direction of travel that they are more than happy and content to move down, and that it is incumbent upon us all to work together in a positive way moving forward. And so I am an open door. Please bear with me. It's a very steep learning curve for me, but I do believe that we can achieve some very positive outcomes, and the more conversation we can have, the better. And I look forward to working with you all, but to all of you as elected members, but specifically as with the committee, because obviously your knowledge and understanding of the processes and the roles is paramount to the success of having those conversations. I just wanted to sort of put that in, just so that you know that that I think we need to gain confidence as members that we are working together as a whole team. So that is both elected members, residents, partner agencies, and of course our own officers, to actually achieve the best outcomes for our kids. Okay.
Thank you, Councillor Aitken. Thank you, Councillor Healy.
Thank you, Chair. I welcome those comments from the portfolio holder. And I'd just like to say, and the comments of the last 5 minutes from you as well, Chair, as well, are very encouraging and show a degree of humility, which I think is absolutely necessary here. Ronnie, you did say in your comment, it's not true that the service users haven't been listened to. And I think, as the Chair has pointed out, it is about perception, because clearly they don't feel that they've been listened to, which is why our inboxes are as full as they are. And putting aside the fact that they're not here today, because that's not, I understand, relevant in your case, the main question for me is, in your 10-point plan, around section 3, around the voice, there's a lot of work to be done to do that and to engage properly. We're not there yet. I think the comments that have been made today have been helpful in that regard. What assurances, Ronnie, can you give us, and Owen, that all these concerns and this proper dialogue, engagement, full engagement, so that people do feel taken on, their concerns taken on board and their kids' futures are taken on board? What assurances can you really give to those service users who are listening right this minute that we as a council will listen and take on board and move forward? Thank you, Chair.
Thanks, Councillor Healy. So I think we are listening and we continue to listen. And I think I do take on board what's been said around the perception for some families is that we're not. And so I guess I started with, in terms of building confidence and satisfaction for users of services, we're not getting it right all of the time. And we've been really open that that is the case. The plan does provide that roadmap for how we can move towards a place where we are getting it right. I'm not going to say all of the time, but we are moving into a place where we can, through that kind of rigorous interrogation and support of our service deliverers, effectively performance manage and put in place a process that families feel that they are being actively listened to. And we've taken some steps within a relatively short space of time to be able to move that on. I'm really keen to understand, in addition to the mechanisms that have been described this morning, what else we can do in order to develop and support that confidence building and that perception across the system. So I think we've got a series of things that we are doing. We will continue to refine those things. We'll continue to add further engagement sessions in for families. And remember that they are co-produced and they cover the areas that families said that they wanted further information about. We are evaluating those sessions as families have identified other things that they want adding into that. We will continue to respond to that and ensure that we are providing that continuous insight into the process, alongside continuing to work to improve the system overall. The engagement is critical in terms of because it is a genuine, we do want the best outcomes for children and young people in East Riding. And it isn't good enough when parents are still feeling that they are not being listened to. So there are a series of things that we've put in place. I'm really keen to hear anything else from parents and carers that they feel that they would like. But we also have to ensure that the voice of all stakeholders is brought into view. So we are hearing about dissatisfaction, and I absolutely take on board what you're saying, that if this system was working as well as it needs to, then you wouldn't see the sheer number of emails that you are receiving from parents and carers who are not happy about their situation. We've got to have some measure, though, of that satisfaction and confidence that we can build on moving forward, and a way of being able to demonstrate by using those kind of softer data targets about how the system is improving. And like Owen has alluded to, some of the issues I think are to do with process. So ensuring that we're getting the process right. Sometimes the outcomes we won't agree on always, but I think it's got to be delivered in a way that is respectful of both parents and carers and staff employed across the SEND system. Because ultimately we are all trying to achieve the same outcomes, which are the best outcomes for our children and people across the East Riding.
Thank you. Thanks, Ronnie. I've got Councillor Whittle next, please.
Thank you very much, Chair. As usual, I shall be brief. With regard to the Parent Care Forum, I think that's been discussed to a great extent this afternoon. I do, of course, as the Chair knows, feel they should have been present, but they couldn't do that. With reference to the consultation, the discussions of the plan at a range of forums and sense checked with all stakeholders, Ronnie. I know you've given a list of stakeholders here, and you've also intimated the process is not complete. However, I would like to seek reassurance that, notwithstanding using the schools forum, we do have full communications with and receive opinions from the beginning of the process, and that's your area, early years, nursery schools. I would suggest PVIs as well, because we all have a stake in this, and children's centres, because we do need to be fully inclusive. And whilst we're on the subject of opportunity to comment, I would tend to feel that comments should also further inform the plan, and we need to be able to evidence that input in some way. Can you cast some light and reassure me on this, please?
Thanks, Councillor Whittle. Absolutely. It is kind of trying to ensure that we've included early years and our private, voluntary and independent sector providers, certainly in relation to the sufficiency discussions, and also the training and support in relation to the workforce offer. So I think if I didn't make that clear in the presentation, then we're talking about I think I referred to schools and settings. So I think I'm encompassing all of our colleagues that work across the private, voluntary and independent sector within that, in terms of providing that universal, targeted and specialist workforce offer and support. And actually, it's wherever the child is, we need to make sure we're putting in place the right support and intervention. So whether they're in a maintained school, an academy, or in some of our early years provision or post-16 provision, it's trying to encompass all parts of the SEND system. Sorry, Councillor Whittle, it's not just about comment. It is, and I think again, if I haven't given the reassurance to Scrutiny that it hasn't just been about comments of families or other stakeholders, it has directly impacted on what is in the development and improvement plan. The subgroups that I referred to, that we're in the process of refocusing those subgroups, there is further opportunity to provide further refinement to the actions that are in the plan. Some of those sections aren't fully populated. So I think part of the discussion around engagement was, in terms of who leads that, is the element in relation to engagement for parents and carers read led by the parent carer forum. It doesn't need to be the local authority that leads all elements of this development and improvement plan. On each of the focus groups that align to the 10-point improvement plan, there is the expectation that there is a parent carer representative and meaningful representation of children and young people. So whether that's a separate committee for those children and people who don't want to sit through the focus group, but actually that there is meaningful engagement into the process. And there's further opportunity to refine those actions. As I said at the beginning, it's a document that is a living document, and we need to add that continuous insight. So I think I want to give you some reassurance that that is there and that is meaningfully going to happen.
Thank you. Is that everything, Councillor Whittle? Brilliant. Thanks very much. I've got Councillor Walker next, please.
Hi, thank you, Chair. Thank you as well for a big and very full presentation on the new systems too. Members will know my love of data, and it's my first question is about the level to which that system will record outcomes in the end, because it's clear that it's looking after all of the statutory requirements, the resources and the provisioning. But it wasn't clear from there how you will look at the eventual, the destinations of those children, because that's what we're all working towards. And if I may, I'll pop another question on the end of that, that I won't hide my disappointment at not being able to speak with other stakeholders at this meeting as I expected to do some months ago. But I fully understand the critical nature of personal information security, especially about these vulnerable children. So perhaps, Chair, it's a moment for a recommendation that we would find a way of a confidential opportunity, because I am still convinced that as well as brilliant as the officer's presentation is, it's one half of the scrutiny committee. So our role, our duty is to make sure that we speak with a range of views. So I know, Ronnie, I know that's not your provision in this, but that's my second question. Can we get a way, perhaps working directly with Councillor Aitken to facilitate, a way that we can meet the people? As other members have said, we get a lot of inbox on this. We need to resolve it as the other side of the question.
Thank you. Before I hand over to Ronnie, I think it's really important that we clarify the difference between scrutiny and acting as independent members. I think if anything like that were to take place, that would have to be done as an independent member rather than as a scrutiny committee, because as we've found out in the weeks preceding this meeting, it's not the responsibility of scrutiny to get involved with that. But if you wanted to do so as an independent member, as I know other independent members are interested in doing, that will be the best place for it. Ronnie.
Thank you, Councillor Walker. So in terms of destinations, so yes, it will have outcome measures in relation to progress and attainment. I think I referred to destinations in relation to children and young people who are not in education, employment and training. The element of that will also look at destinations in terms of numbers of children and young people who go on to further education, employment and training. So I'll look at both sides of that. And obviously that is an outcome measure in relation to the impact that we have had for those children and young people. What I wasn't able to show you today, and I think time was of the essence really, but actually the oversight that the data dashboard now allows us to have will track that journey for those children and young people right from when they become known to us right through to 25 and out the other side. So we're working with colleagues in adult services to ensure that we can interface the transition between children and families into adult services. So I think it and I referred to child and young person's journey. So we are in a position to be able to map that for every child and young person that we have across East Riding with an education, health and care plan. So I think there's further work to do with our destinations for our SEN cohort of children and young people, but we'll certainly be looking at education, employment, training and educational outcomes. The other bit of the dashboard that I wasn't able to share with you today was our tracking of our vulnerable children. So children that are looked after, that have CP plans, or child in need. So actually it has a tracking function around those children as well, in terms of, because obviously SEND is one element of what sits within specialist services. So within the service that I manage and lead, our virtual school for looked after children also sits within that, and also commissioning. So it's there's some of the outcome measures and the look at destinations. It will also kind of be able to track the number of young people that we have going on into higher education. Obviously, in terms of an education, health and care plan, if you have a plan and you go on to higher education, then that plan is ceased because the format for support is different. So it's about making sure we're wrapping around those children and young people the right level of support to support them on their journey in preparation into adulthood. Okay.
Thank you. Yeah, I've got Councillor Aitken who's waving at me on Zoom.
Thank you, Councillor Weeks. It was really just to quickly come back to Councillor Walker's comments, and I to sort of basically offer, just reiterate my offer that I think that possibly my role, the role that I'm holding at the moment, can perhaps help facilitate those conversations with parents. So, and then perhaps at a later date, you can invite me to Scrutiny along with officers to actually enlighten the committee as to how we have progressed that conversation's future date. So that it sort of takes the sting out of it actually being in Scrutiny, but there is still, Scrutiny still has the role of having assurances that those conversations are being had.
Thank you, Councillor Aitken. I think that's a really positive way forward, and it's a much more appropriate venue through you rather than through Scrutiny. I have had wiggles from Councillor Nicholson and Councillor Bayram. Do they still stand?
Very brief, if that's okay.
Yeah.
Just on the back of that, it is worth clarifying that as a member also of OMC, myself and a number of members did push hard for parents to come to Scrutiny. And I think what we've, I just wanted to reassure parents that at no point have officers or anyone tried to frustrate or prevent that activity taking place. I just think with the advent of time, with the introduction of the plan, and most recently with the new portfolio coming on board, we've all recognised that actually there is a better way to do that job, and we all as members remain fundamentally committed to try and to understand the frustration and pain and anguish of parents who have a daily struggle, not just with looking after their own children, but with a system that is trying to support them, but for one reason or another is failing. So we all remain totally committed to that, and we will work with the portfolio holder and members to do that going forward. I just wanted to reassure people that that was our commitment going forward still.
Thank you, Councillor Nicholson. Councillor Bayram.
Thank you, Chair. I don't know if all members had got the information, but the Parent Carer Forum is having a coffee morning this week. And if people went along, then they could actually speak to them to get the other side of the story. I don't know if Ronnie would be thinking that was a good idea that councillors went to these forums. I went with Alison there a lot of years ago, and I found it very useful myself, if Alison remembers. And I was quite shocked really to see how they were struggling, and there was only one person there who knew how to fill in the forms and everything to get the benefits they needed, let alone anything to do with the children's welfare and that. So now it is, you know, worth speaking to people. Thank you.
Thank you, Councillor Bayram. Councillor Bayram's correct. Members have been invited by the Parent Carer Forum. The group officers have got the information if you've not already received the email, and whilst it's not compulsory, you are more than welcome to attend. Okay, if we can start moving on. I've got Councillor Beaumont next, please.
Thank you, Chair. Ronnie, you mentioned that over 200 of our children are cared for outside the authority. Could you tell me how many of outside children are catered for inside our authority, and why this is happening on both those occasions? And then finally, of that 200 children that are cared for outside our authority, how does that compare when we sense check ours against other authorities as a percentage of the population, for example? Thank you.
Okay, thank you for the question, Councillor Beaumont. So I think all authorities have and it very much depends on the geography, doesn't it, of the authority that you're working in. But I think given the particular geography of East Riding and the proximity to Hull and families that are living on the border between East Riding and Hull, or right on the outskirts of East Riding in Goole with some of the connecting authorities, you will always have a number of children, young people, because it is closer for them to go to school just over the border than actually travel to another school within authority. And clearly parents can choose to, through admissions, to express a preference for a particular school. I'm not talking about children with additional needs, I'm talking about children generally. And it's not dissimilar for those parents and carers of children with additional needs. So actually statutorily, a parent can express a preference for a particular school. It does not have to be the nearest school, but the local authority should always consult the nearest school that is able to meet need. But we have to be really clear, if parental preference is for another school and they're saying they can meet needs, then it's the parent's right to access provision in that school, and that can, dependent on where they live, be over the East Riding border into another authority. Equally, we've got families who pay their council tax to Hull or to some of the other authorities that border East Riding, accessing their educational provision in East Riding. So we have a degree of that at all times, and I think it's more pronounced in certain authorities than others, partly to do with geography. In terms of the numbers of children that are accessing provision within East Riding across the piece, I don't have that information to hand. In terms of what I do have to hand is the number of children who have an EHCP, perhaps that's some of our children looked after cohort who are looked after to another authority but are accessing their provision within East Riding. And again, we get into quite small numbers of children and young people in terms of the amounts of that relates to. So I'm not trying to avoid the question, but in terms of how we compare with regional and national, I'd need to go away and have a look to see if we've got more children that come into East Riding as opposed to children that go outside of East Riding.
Okay, thank you, because I think it would be a useful exercise to do. I'm constantly surprised that the lack of times that this council or other councils don't compare themselves with other similar councils that may have either similar geographical boundaries or socio-economic groups. So there's always a risk that we may be missing a trick by some counties who are very good at doing certain things, but we don't pick up on it. We don't ask them, why they're doing so well versus we're not doing very well ourselves. So I just think it'd be a very, very useful exercise for us to actually find out how we do compare, not only in this, but in other forms of performance across the region. Thank you.
Thanks, Councillor Beaumont. I guess we have looked at that for lots of areas in terms of how we compare regionally and nationally, but in terms of that particular point, no, I would need to go away and look at that.
Sorry, I was just working out who's speaking next. We've got Councillor Handley next, please.
Thank you, Chair, but John's had his hand up for quite a while, and I
Yes,
just wondered.
he's next after you.
Sorry. Ronnie, I have to say, what you've produced today is outstanding. I have to say that, because in 6 months, the distance that you and your team have travelled has been amazing, in my opinion. Can I just ask you, the area of focus being the needs, what are we actually putting in place as a council to actually take those young people forward with these, with their EHCPs, and obviously being NEET as well? What are we at that stage yet that we actually know what we're doing and we've got things in place? Thank you.
Thanks, Councillor Handley. Yeah, so by it being an area of focus, so we've got a clear action plan for all of the children and young people that are not in education, employment and training. So part of that has been, some of them are in employment, and it's been that we have not ceased the education, health and care plan. So we will go through a process of ceasing some plans, which will reduce those numbers. And for any children where educational outcomes are still to be sought for them, there will be a review of that provision, and we will bring that back into view. So really clear about where those children are across the East Riding, how old those children are. Some of those plans do need to be ceased, and so it's been the data as an area of focus has identified that we have not been ceasing plans when those young people have moved into employment. Some of those children and young people are no longer wanting to engage in education, and have clearly made that their views very known. So again, through a review process and formally reviewing outcomes in the plan, if there are no further educational outcomes to be sought for them, those plans will be ceased. And for children where there are still educational outcomes to be sought, they have been allocated to officers within the SEN assessment team to actually work with those children and young people and their families to get them back into education, employment or training.
Thank you, Ronnie. Can I just also add that I think everybody will be aware that education's a constant movable feast, and it never stops. And as soon as you've done one thing, you're on to the next. So I know how difficult it must be. Thank you.
Thank you.
Thank you, Councillor Handley. I've got John next on Zoom. Sorry to keep you waiting, John.
No, that's all right. Thank you. Councillor Handley's stolen some of my thunder to a certain extent, because whilst I fully understand and respect the focus and the importance of parents and carers' views and concerns, I think I'd want to go on record to recognise the progress that we've made, that the officers and employees have made with since Ronnie's appointment. And I think there's an awful lot of work gone in, and I think we need to recognise that progress. On to my question very quickly, because I'm conscious of the passage of time. As a retired head teacher from the East Riding, I know the concern has been from the past from colleagues about early intervention and early assessment. And I would just like to ask for some reassurance that we are putting in a focus, especially with Ronnie's early years background, that children are being identified as early as possible and resources put in to support this.
Thanks, John. So absolutely, you wouldn't expect me to do anything else other than to ensure that all parts of the system were identifying children at the earliest opportunity. So there's already been some really positive discussions with our colleagues in health, because I think it's really important that we integrate our activity across education and health, that we've identified that children are in provision and that we are working collectively to ensure that children are accessing provision at appropriate points in terms of being really clear about their development. We're looking at under 10 under the workforce strand. There's a lot in there. I know it didn't appear to be a huge amount in terms of the goals, but there is a really consistent way of being able to look at early childhood development, but also to create a mechanism for being able to do that across early years, primary and secondary. So we can look cognitively at where the child is developmentally and what progress they're making in terms of good level of development or age-related expectations in relation to school age children, and to use that as a progress tracker, but also as a way of moderating the type of provision those children and people are accessing. Sitting behind that will be a really clear and comprehensive explanation of the best endeavours duty, so what schools and settings are required to do in relation to children and young people with SEND, alongside the support across the universal, targeted and specialist offer that we expect the local authority to provide, and at what point that intervention will be put in place. The integrated specialist teaching and support service that covers the whole graduated offer is to try and provide that support to recognise need early and to have that toolkit of interventions that you can put in place. So that whole plan, do, review, cycle and approach. And obviously in early years, you need to be an expert in early childhood development and understand that where children are not typically developing, what we need to do about that. You're often still investigating what's happening, but actually having plans in place as appropriate for children that require them is really key, so that we know about those children at the earliest point and we are working collectively together to actually address and meet need.
Thank you.
Thanks, John. We've got Councillor Holmes, please.
Thank you for the very informative presentation that we've heard today. And we hear the strong message which has come through that progress has been made, is being made, and will continue to be made. I would like to ask you a question about the data that you have given us in slides 10 and 11 on performance and appeals. And I note that there has been a dramatic increase in the ability to comply within 20 weeks in terms of performance, rising from 32.6% in 2019 to 90.40% in 2020 and 95.20% currently. In relation to the disagreement resolution data on slide 11, I note that it only currently goes up to 2019. And so my question is, when would we expect to have the data about the appeals as a proportion of appealable decisions from 2020? And would you expect to see an increase in the percentage of appeals as a result of the increase in speed at which performance has been driven?
Thank you, Councillor Holmes. In terms of the 2020 information, we've published what we have available. I can go back and just have a look at the 2020. There's nothing in the SCN2 information that I've been able to access that I think when I actually produced these slides, I could have put the 2020 information in actually. And I think that's just been an oversight on my part. So I think we are, as I've said, tracking slightly above the Yorkshire and Humber average for disagreement resolution, but we and in terms of numbers that kind of pertains to, I can just get into this system. I'll tell you if what that looks like. We've seen a drop in 2020, but I think that's to do with what I talked about earlier, where we've not had a typical year. In terms of 2020 is not a typical year, 2021's not shaping up as a typical year either. So I think whatever the data is telling us, the data tells us part of the story. We've still got, and as I said, any position where we end up going through to tribunal is and whatever the outcome for me, it's we shouldn't be in a position where things are going through to tribunal. We try and avoid that at all points in that process, in terms of mediation, in terms of speaking to families to see if we can mediate an outcome. And so in terms of the, so we try and resolve it before getting to a position of things going through to send tribunal. And there are a number of, but obviously it's parents' right to do that. They might not be happy about the provision that is named in the plan, or the, and obviously at the moment, the bit that I do need to separate out is that we're piloting nationally the single route of redress. So that is the tribunal process can also look at health decisions in relation to the single route of redress pilot. So I just need to separate out the two, which I think will give a more accurate reflection of where we are. Sorry, I don't feel like I've answered that very well. Does that answer your question?
Yes, thank you.
Thank you very much, Councillor Holmes. That's it. We have no more questions for you, Ronnie, which I'm sure you're relieved about. So if we can move on then to recommendations. Councillor Nicholson, you mentioned you had a recommendation to raise at the beginning.
Yeah, I'll be as brief as I can. Chair, thank you for that. I think a lot of what we've asked today has not so much been about the content of the plan, but more around that effervescent skill of communication. So I think the recommendation that you and I had discussed and that we were talking about dovetails nicely to what Ronnie said, which was, you know, what more can the council do? What more can your team do to communicate? And you'd be interested in hearing recommendations. So I think that it would be prudent to support, you know, to back up our comments today and support officers with a fast track review panel looking specifically into how the council communicates with SEND users, not just the Parent Carer Forum, but other users as well, with the caveat that you know, that it's really the job of children and young people to thrash out the scope of such review. But I would like to put that as a recommendation, that we do support members proactively with our comments and take a look at the comms.
Thank you, Councillor Nicholson. Do any members have any objections to that? I'm not seeing any. Okay, so we'll add that on as a recommendation, which I imagine will go to overview management for approval. I'll have a conversation with you after the meeting, Councillor Nicholson, about logistics, and we'll get that to the next meeting of overview management. Have we got any other recommendations, Alison? I've got my sheet of paper in front of me. We've definitely got it on the work programme to receive a further update on the meeting of the 1st of December, which I think is a nice follow on. That's 6 months' time. That should give you enough time, Ronnie, to start to get to see how the 10-point plan is working. And I think in the spirit of how we approached this back in October, it was always clear to us that what's needed here is time in order to see the changes that are being implemented to be implemented. And what we've seen over the last 6 months is a marked improvement in the service itself. And I think we should hopefully see that again in another 6 months. So if we work on the basis that will be coming on the 1st of December, I'd also like to, just before I hand over to Alison, on a personal level, add a recommendation in to say that as a committee or committees, we commend the work that you've done so far. I think it's important, as John pointed out, that we don't lose sight of the journey that this service has been on since it came to us back in October. There are, in your own admission, there is still things to do and there's still improvements to make. But I think certainly in the 20-week time scale, to go from 35% to 95% is an enormous achievement. And that doesn't happen without hard work of you and all the staff that work underneath you. So I think from the committee's point of view, unless there's any major objections, I'd like to add that on as a recommendation that we commend you and your team for the work that you've done, because it is quite extraordinary. Although there's still ways to go, I think that the progress that's been made has been excellent. So if everyone's happy with that, we'll get that added on. Alison.
Yeah, the only thing I was going to say is that right at the beginning of this item, Ronnie said she was waiting for guidance from the Department for Education, but she'll be able to give a written briefing about exams and the process of that.
Yeah, so we discussed at the beginning of the meeting in the first item that we would we'd do that on exams, and I think if we can arrange for it to form the part of the COVID report for the next meeting, it may be worth. I don't know whether is Deborah due to come to the next meeting. I don't think she is. But either way, we can discuss that. We can discuss that with Owen and Deborah ahead of the next meeting. John, on Zoom.
Thank you. I just feel that we've discussed the issue over finance, which is key for resourcing developments in SEND. And I just wonder whether we need some sort of recommendation where we've encouraged committee members to get engaged with writing to MPs or whatever. But I think if we're going to have success and these plans are going to be delivered, we need the finances to do it. And I think some sort of commitment to supporting officers to get that funding would be useful from this committee.
Thanks, John. I agree. Perhaps we can look at a joint lobbying strategy between the two committees to put something together. Again, if we can get that down as a recommendation, I'll sit down with Councillor Nickerson, and between OMC and Children and Young People, we'll look at a sort of joint lobbying approach for that, which I think would be really useful.
Thank you.
So, has anybody got anything else? I'm tempted to just run, I think, at this point. I'm not going to ask if there's any more. So thank you all so much for the hard work that you've put in, Ronnie and Owen. We're going to move on now to the next agenda item, which is our work programme. And Alison is going to be very, very quick. Please.
You'll be really pleased it's really quick. I've got nothing to update you on the work programme, and there are no forward plan key decisions.
Very good. Right, well, thank you all so much. It's been great to have you all here in person